أن تعطي شفاء لكل مريض، وبالأخص مرضى الكورونا، وأن تعطي يا رب أيضا حماية لجميع الأطباء والممرضين وكل من يعمل في مجال الصحة وكل من يتعامل في المواجهة مع هذا المرض. أعطي سلاما لشعبك يا رب في كل مكان وطمأنينة، وارفع عن العالم الغلاء والوباء وسيف الأعداء وكل مكروه بشفاعة أمنا العذراء القديسة مريم وجميع القديسين. اسمعنا حينما ندعوك بالشكر ونقول: أبانا الذي في السماوات ليتقدس اسمك، ليأتي ملكوتك، لتكن مشيئتك كما في السماء كذلك على الأرض. خبزنا الذي غد أعطنا اليوم، واغفر لنا ذنوبنا كما نغفر نحن المسلمين إلينا، ولا تدخلنا في تجربة لكن نجينا من الشرير بالمسيح يسوع ربنا لأنك آمين.
Thank you so much, Sayyidina Nephi and David. Would like to thank Your Grace for helping all of us, either on the front line or people actually affected by the coronavirus. ونيافتك يعني من البداية، ونيافتك بتعتني خالص بالمنطقة. Wonderful organization with everybody, and we took that opportunity for Holy Sophia University, which Amba David is the president of the university, to invite our wonderful doctors from CMANA organization, and they are coming to answer all the questions that we received. Sayyidina, we received about 69 question, and we're gonna rotate the questions among the specialty. فاحنا يعني نشكر ربنا انه قدروا ان هم يبقوا معانا النهارده. و this session يا سيدنا is broadcasted right now, live streamed على هولي صوفيا University Facebook. فيعني I would like to introduce one by one, and Abu Nabshoy will introduce also the doctors, and I'm going to start with Dr. Hani Ashamallah. Dr. Hani Ashamallah, he is the director of CMANA. He's the chairman and clinical professor at New York Presbyterian Hospital. He has been practicing medicine in the US since 1996. يعني I would like to ask Dr. Hani Ashamallah to speak to us, tell us يكلمنا شوية عن مؤسسة سيمانا لو تسمح دكتور هاني.
Sure, يا بوناس. Thank you, Sayyidina, for sponsoring this platform, and thank you for Sophia University. CMANA stands for Coptic Medical Association of North America. It has been in practice for about 10 years now or so. Basically, it connects all the Coptic doctors, not just North America, although it started this way. Now we have hundreds of doctors in many specialties. We have many objectives, but currently we are very focused on helping, giving consultations through telehealth. And I'll let Ayman Farag, one of my colleagues here, to comment later on it, and responding to anyone who has questions like this forum. We also do a lot of missions all over the world, medical as well as spiritual. We report to Sayyidina al-Baba directly for anything, but also because we are in New York, we like always to come back to Sayyidina Amba David for his guidance in everything we do. I'm very honored to have many of my board members in this call and all the doctors who are joining us from all over the world. We would love to see you as members of CMANA as well. Thank you.
شكرا. دكتور هاني بيقول انه يعني واخد البركة انه خدمة سيمانا في العالم كله، ليس فقط في خدمة طبية ولكن ايضا في خدمات روحية تانية، والممبرشيب مفتوح لكل دكاترة من العالم كله. وهم طبعا اللوكيشن بتاعهم الهيد كوارترز في نيويورك، فبياخدوا دايما الادفايس وبركه نيافه الانبا ديفيد، وفي نفس الوقت هم في حالات كتير قوي بيتعاملوا معاها مع قداسه البابا من مصر. شكرا يا دكتور هاني. ابونا بشوي اتفضل. next one is...
Sure. I would like to start by introducing actually Hegomain, Father Dr. Azmi. He is a priest of the Church of the Virgin Mary and Archangel Michael for the past 20 years. And prior to this, he was an internal medicine physician in Pennsylvania. And he is now also, in addition to being a priest, is also the Dean of Holy Sophia University, as well as serving at the church.
Also, Abuna Bishoy Salib, he's has been with us since 2011 as internist, practicing in Connecticut, and wonderful person as a physician. Then recently, back in October of 2019, أبونا بشوي نيافة الأنبا ديفيد رسمه لنا كاهن جميل، وبناخد بركته دايما وربنا يخليه لنا. ولسه he still has his license also to practice medicine. Thank you. Dr. Ayman Farag. Dr. Ayman Farag, he is specialized in ICU, working at St. John's Hospital, New York. Dr. Ayman Farag, also one of the physicians at CMANA. We are very happy to see Dr. Ayman Farag. He's the chairman of the anesthesia and pain management at St. John Episcopal Hospital في كوينز، وهو بيخدم برضو في هيئة CMANA.
And we also have Dr. Sharif Binyamin Mossad. He's a physician staff in infectious disease at the Cleveland Clinic in Ohio.
Thank you.
Okay. We have also with us Dr. Michael Karas. Dr. Michael Karas is a pulmonology and the critical care fellow in New York Presbyterian Hospital, and also هو بيخدم مع هيئة سيمانا وتخصصه صدرية وحالات الحرجة.
And also we have Dr. Mina Merhum, psychiatrist at Columbia University Medical Center, I believe also with CMANA as well.
And we have with us also Dr. Andrew Mikhail. Dr. Andrew Mikhail, he's a psychiatrist from Pennsylvania. Dr. Andrew Mikhail also بيخدم في مع سيمانا، وبرضه بيتعرض للحالات اللي محتاجة بجانب حاجات النفسية حاجات الروحية أيضا. Thank you so much. Can we start our questions? So I have a question for Dr. Mossad. Dr. Mossad, the question says that how long does it stay on different services regarding the COVID-19? Kind of the cloth, papers, metal, and wood. قد ايه بيقعد الميكروب بتاع كورونا فيروس على الاسطح زي القماش او المعادن او الورق او الوود.
So there are data specifically for the coronavirus, the current one that is causing the pandemic, and there are some data that are for other coronaviruses. So I'll lump these together because they're very similar. So on wood, it's about 4 days. On paper, same thing, about 4 days. On plastic, about 3 days. Stainless steel, about 2 days. Cardboard, about 2 days. And we're always thinking about cloth, particularly our masks, but there are really no data to say how long it stays on the cloth, because the cloth masks that we have we wash these, so we really don't know how long exactly, how many hours it lasts on the cloth.
Thank you, Dr. Mus'ad. Let me translate this. Dr. Mus'ad بيقول
أنا أعرف عربي، أنا ممكن أتكلم بالعربي لو عايز.
both لو تسمح. حلو قوي، اتفضل.
So في الوقت الكورونا فيروس الحالي اللي عامل الوباء الحالي او الكورونا فيروس ان جنرال، لان في اكتر من كورونا فيروس. يعني لميت معلومات عن الاثنين. فعلى على الخشب حوالي 4 ايام، على الورق حوالي 4 ايام، على البلاستيك حوالي 3 ايام، على الحديد حوالي يومين، على الورق المقوى او الكرتون يومين، وعلى الكبر
نحاس.
افندم؟ النحاس حوالي 4 ساعات. فاقل حاجه نعرفها النحاس. على القماش فما فيش يعني published data، ما فيش information معروفه عن بالظبط كام دقيقه او كام ساعه على القماش بالذات.
شكرا.
The next question, it's for one of the doctors who's not yet with us, but maybe Dr. Karas, if you don't mind answering.
Sure, happy to.
Is the malaria treatment effective? And when is it in the course of the disease, is it effective?
Thank you, Bruno. So initially, hydroxychloroquine and chloroquine were used, especially the azithromycin, because of studies that came out of China and France in the early days, and it was a 5-day course for the treatment typically. However, with newer data coming out of the US, it's falling a bit out of favor, and it's being used less and less frequently at different institutions. The studies are not fully out yet, so it's not fully proven harm or benefit at this point at the global scale. But as we have more studies coming out, hopefully I have something a bit more definitive.
Okay. ممكن يعني أترجم أو حضرتك تترجم؟
Sure, yeah, ممكن هحاول أترجم. So basically في الأول الدواء يعني ابتدى يستعمل علشان trials أو studies اتعملت في فرنسا وفي الصين. But they were يعني small scale studies، كانت studies صغيرة لعدد ناس مش كبير. And they weren't يعني ما كانتش designed very well, very small studies. And it showed some benefit at that time as an antiviral. With newer studies طلع من أمريكا, it doesn't seem to be as beneficial as it was assumed. So في الأول كان في كتير من institutions including our institution كنا بنستعملها almost regularly لكل حد داخل المستشفى. دلوقتي as more data is coming out بنستعملها less and less. يعني we haven't been using it for the patients اللي بيخشوا دلوقتي في المستشفى أو العناية المركزة. So as we have يعني لما يبقى في studies أكبر هنبقى نعرف exactly if it's most useful في الحالات دي.
شكرا. السؤال دكتور مسعد أيضا. The word asymptomatic, somebody is asking what does it mean؟ معنى ايه asymptomatic او معلهوش اعراض؟ و يعني هل ممكن ان هو يمشي الميكروب من الاسيمتوماتيك للعادي؟ Can that virus be spread from asymptomatic person to regular person? You are muted, Doctor.
Muted, sorry. An asymptomatic infection means someone gets the germ but is not showing signs of infection. There are many infections like this that we can get infected but don't get manifested signs of infection. And this does happen in this coronavirus. We don't know how much, but we know for sure that it does happen. And yes, it can spread from a person who doesn't show symptoms to someone who is completely susceptible to this infection. But the risk of transmitting the infection from a person who is asymptomatic to another person is clearly lower than the risk of transmitting the infection from a person who is symptomatic to someone else. And the better term would probably be pre-symptomatic, because we don't know whether they will be symptomatic or not at the time we label them asymptomatic.
Wonderful.
هترجم الشخص اللي ما عندوش أعراض ممكن يكون جاله الميكروب بس لسه ما عندوش أعراض للميكروب، وده ممكن ينقل الأعراض الميكروب لشخص آخر قبل ما يحصل له الأعراض، أو ممكن ما يحصلوش الأعراض خالص وبرضه ينقل الميكروب لشخص آخر. حجم النقل ده أقل بكتير من حجم النقل لو عنده أعراض، يبقى أكتر بكتير إنه يقدر ينقل لشخص آخر.
شكرا.
The next question is also for Dr. Karas. How can we daily exercise, such as walking outside of the home, help build our immune system and relieve stress?
So exercise is touted as the miracle drug for almost anything. If you're ever in doubt about exercise, you should do it. It's amazing. It's helpful psychologically, physically, emotionally, on all realms. It is amazing. But it is a balance. Typically when we talk about exercise, we're talking about moderate exercise that is compatible with what you're able to do. And especially when you do outdoor exercise, it's great to interact with nature and to get sunlight. All these things are very beneficial. However, if we're talking about severe or heavy exertion on a more regular basis, that would actually may have a counterproductive effect on your immune system acutely in the short period of time. So I would not advise, for example, going out and doing a marathon every day to improve your immune system. That might be counterproductive. But regular exercise, about an hour a day, depending on your level of how much physical activity you've been doing, is very beneficial. And it's actually very well published as to how exercise is also helpful on the psychological realm. I'm sure my psychological colleagues would agree. It's effective in depression and anxiety, even in schizophrenia. There's a lot of published data on that. So definitely highly suggested to include it as part of your day.
Thank you so much. دكتور كراس بيقول انه الاكسرسايز دي مهمة جدا، ان هي تقلل الاسترس وبتساعد العيان، بس لو زيادة قوي 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 معناها انه ممكن الارهاق ده يقلل اكشوال المناعة. ناخد السؤال اللي بعد كده، ننقل على الدكتور مرهم، سايكاتريست، حاجة نفسية. How should parents explain COVID-19 to their kids؟ ازاي الاهالي تشرح اللي بيحصل ده كله لعيالها، لان العيال خايفه.
طبعا شكرا. هحاول بالعربي والانجليزي. So I'll start first in English. The one helpful recommendation from the CDC is to follow a couple of guidelines, and I'll put them into something easy to remember as 4 T's. So the 4 T's when you approach this conversation with a child. The first one is tone, because children don't just listen to what we hear, they listen to how we say it. So if we are speaking to them and trying to reassure them, but we ourselves are terrified, the children will always pick up on that. So the first thing we want to be aware of is our tone. The second T is time. So this is not the kind of thing that you want to say bil marra in the kitchen as you're making the next Fatari meal. You want to set aside some time, and you want to make sure there's time for questions, because children are very curious. They're going to have a lot of questions. Why this? Why that? How come we're not doing the things that we're always doing? Okay, so first tone, then time. Third T is TV. So there's the information that you're giving, and then there's the information that's coming out there from everywhere else. What the children are seeing from social media, what they're seeing from the news, a lot of it is terrifying information. So you want to try to limit the false information or limit the exposure to the amount of content out there to begin with, so that you can sort of help control the narrative. And the last T is truth. Children, even though, of course, you have to communicate this as age appropriate, you're going to say something differently to a 3-year-old than you would a 13-year-old, but ultimately, please be truthful. And we can communicate truth in a way that is calm and present and sustained for the child. فبالعربي عايزين نقول ان يعني في 4 حاجات عايزين نفكر فيها. اول حاجه طريقه الكلام، مش بس الكلمه نفسها، بس ازاي انا بتكلم مع الطفل. فانا لو خايف هو هيخاف، هو هيبص لي ويقول لو بابا خايف انا هكون خايف برضه. تاني حاجه الوقت، فعايزين ناخد شويه كده 5 دقائق 10 دقائق. طبعا احنا عندنا وقت كتير قوي دلوقتي ممكن all day نقعد في الزوم، فعلى الاقل ممكن نقعد شويه مع الطفل نقول اوكي لو عندك سؤال اسالني وانا هحاول اجاوبك. ثالث حاجه التلفزيون او الانفورميشن اللي بيكون موجود، نسمع حاجات من تلفزيون، من سوشيال ميديا، من فيسبوك وحاجات كده. فعايزين نحاول نقلل شويه الوقت اللي الطفل بياخد المعلومات دي من مصدر تاني. واخر حاجه الحقيقه التروث. فعايزين نتكلم مع الطفل برضو بطريقه بسيطه بس طريقه صح، يعني طريقه accurate truth، عشان ما في الاخر برضو our children هم اذكياء جدا طبعا، ربنا يخليهم لينا، بس فعشان كده لازم نكون يعني intentional ان احنا نقول حاجات صح ليهم بس بطريقه reassuring. شكرا.
Thank you, Dr. Miram. And the next question is for Dr. Ashamalla. The question is, what steps can the Coptic community take to help build our immune systems?
Really, the immune system in general doesn't need anyone to build it, but to keep it built. In other words, as long as you don't do things to reduce the immune system, God created a very well-built immune system which can sustain anything, including coronavirus. The problem with us, because we are a very close community, especially in Egypt and especially in places who are very close to each other, people like to hug and kiss and spend time and use utensils from each other. So now we are almost trying our immune system. The second thing, alcohol, especially in large amounts, can reduce our ability to really conquer some of these infections. As long as we don't take any chemotherapy, any medications to really, like a rheumatoid arthritis patient who is taking methotrexate or something. اللي أنا بحاول أقوله إنه الجهاز المناعي بتاعنا ربنا خلقه قوي وممكن يقف قدام فيروسات كتيرة including منها الكورونا. المشكلة إن إحنا كشعب بيحب بعض وبيحب الترابط، أوقات ما بنرضاش نسمع الكلام إن إحنا نبعد عن بعض ونبعد عن الناس اللي ممكن تعدينا وما نستعملش حاجات بعض، وده طبعا اللي بيخلي الجهاز المناعي بتاعنا يتحط في خطر، لان انت بتضغط عليه، بتديله حاجات كتيره في نفس الوقت، او ان الواحد ياخد مخدرات او ياخد كحوليات او ياخد اذا كان بياخد ادويه تقلل المناعه. غير كده الحقيقه الجهاز المناعي مفيش حاجه ادويه تزوده، مفيش فيتامينات تزودها. في قولان الفيتامين سي ممكن يحسن، لكن يعني بدل باعتدال الفيتامين سي مش هيضر. هل هيزود المناعة ولا لا؟ بصراحة ده في قولان عليه.
شكرا دكتور هاني. دكتور مسعد again. سؤال برضو infectious disease. How long do droplets linger in the air after someone coughs or sneezes? قد ايه بعد ما الواحد يكح او واحد يعطس الميكروب يبقى متعلق في الجو؟
So this is probably the most debated question about this disease, because it sorts infectious diseases that are transmitted by respiratory measures to either a droplet or droplet nuclei. Droplets are larger than droplet nuclei. So when someone coughs or sneezes, the droplets are forcibly traveling within a distance of about 6 feet or 2 meters, but then they don't stick in the air or linger in the air for hours. I tried to find out specifically how many minutes, and there is really no answer. It just says short period. So I would say minutes for the droplets to drop to the ground. Obviously, sneezing, I would think, would create stronger or faster speed for the droplets to move more faster than cough. For droplet nuclei, these are much smaller, and there are only 3 truly aerosolized infections that get transmitted and stay in the air for much more than minutes: measles, chickenpox, and tuberculosis. So بالعربي الرذاذ اللي بينتج من العطس او الكحه بيقعد في الهواء او بيقعد في الجو دقائق مش ساعات. والفيروس ده بالذات المتعارف عليه او المقبول عنه من خبراء كتير انه بيقعد دقائق مش ساعات، وانه بيقع على الارض في خلال دقائق، في خلال مسافه حوالي 2 متر او 6 أقدام. الامراض الثانيه اللي ممكن تتعلق في الهواء لمده ساعات هي الحصبه والضرن و chicken pox. Someone help me please.
الجديري.
جديري مش جديري الميه. اوكي جديري. اوكي. دي الحاجات اللي معروفه ان هي ممكن تتعلق وتقعد ساعات في الهواء وتتنقل بالطياره، مش الكورونا فيروس كما هو معروف.
Thank you.
Next question is for Dr. Farag. The question is, if a group of young, healthy Coptic men sit less than 6 feet apart for a prolonged period of time, could the virus spread between them and then end up infecting a grandparent sitting at their homes?
المشكلة في اليونج people, when they get together, they get closer than 6 feet. And the chance for grandma to get infected, grandpa to get infected at home, it is very high. For Sweden, they isolate everybody above age of 65 in total isolation. They were not even the grocery delivery or food delivery or anything delivery. It can be left in the front door without even seeing the person. The 65 people and above, it is very highly people get really affected by yes. الشباب الصغير لو get together في some kind of underground party أو some kind of gathering together، خلاص ده بيدي chance إن لو واحد فيهم infected they can transmit this infection to الناس الكبيرة في السن، وده ممكن يدي very big impact على ال old population. وعشان كده أحسن حاجة إن become really isolated by themselves. They should sit at home in their own room without even interact مع الناس اللي في البيت. والناس اللي في البيت لو كانوا بيخرجوا كل يوم بره, when they come back to the house they should use mask and gloves.
شكرا. اوكي. السؤال لدكتور كاراس. What medical advice can you give to deacons, young, strong, feel they are exercising their freedom of choice, then feeling confident that going home, it is simply they are not going to hurt anybody?
So I think that is what a lot of young and healthy people feel like. Even myself, that was the initial understanding. But if you walk into the ICU and you see the 20 and 30-year-olds that are on ventilators, on life support, it does change your perspective altogether. So are they less likely to have severe symptoms overall? Yes. But can they progress and be on life support? Yes, 100%. I've seen patients in their 30s that have passed away from COVID. So it's something to keep in mind. Also, as someone who is serving others at the church, that message doesn't stop at the door of the church. So if I know that I might take that virus and transmit it to my family members, to my parents, to my grandparents, and to my friends, I would think twice before doing so and being a vector and a cause of harm to others around me. So بالعربي معظم الناس اللي في السن العشرينات الثلاثينات بيحسوا ان مفيش حاجه تقدر تاثر فيهم، بس لما تخش في العنايه المركزه وتشوف ناس عندهم 20 سنه 30 سنه على لايف سبورت، بتحس ان لا يعني you can. في ناس في الثلاثينات كانوا بيموتوا من كورونا. ف it's something to keep in mind. وبرضه لو واحد بيخدم في الكنيسه كديكن كشماس، الخدمه ما بتقفش في الكنيسه، فبروح الخدمه لو انا فعلا يعني I'm caring على ابونا، لو I'm caring على اهلي في البيت، على اصحابي، هخلي بالي ان انا ما اروحش، ان انا يعني عشان انا عايز اخدمهم مش هكون سبب ان انا اجيب لهم عدوى في البيت او في حته ثانيه.
Thank you. Next question for Dr. Ashamala. Why do the number of cases for previous days increase?
I'm not sure if this is a correct question. Actually, the numbers in the last few weeks, at least in our hospital, and it's a COVID center, has decreased. Actually, if I compare second week of March with the third week of April, and I looked at these numbers, at that time we were about 400 patients admitted and 69 patients on ventilators and 20 waiting for ventilators. Now we are 289 admitted, 23 on ventilators and none waiting. So actually we are at least 15% less the last 10 days compared to the first 2 weeks of March. اللي أنا بحاول أقوله يا جماعة الفيروس ابتدى يقل. ده مش معناه إن إحنا طبعا نغير من طريقتنا أو طبيعتنا، لكن الأرقام أحسن كتير. عدد الناس اللي بتدخل على تنفس صناعي قل، عدد الناس اللي بتموت قل، عدد الناس المستنية تنفس صناعي قل كتير جدا. وبالتالي أنا مش عايز أقول إن إحنا يعني خايف أقول كده لحسن الناس تفقد البعد المسافات، لأن ده الحاجة الوحيدة تقريبا اللي الطب اتفق عليها، إن البعد هو الحاجة الوحيدة اللي فرقت في تقليل عدد الناس اللي بتصاب بالمرض، بس هو المرض فيه بيقل يعني.
شكرا دكتور هاني. infectious disease again. دكتور مسعد. اوكي. هل ممكن واحد عنده كوفيد 19 وخف ينقل العدوى للآخرين؟ Can someone who has had COVID-19 and recovered spread the illness to others?
Yes, they can, but it is clearly much less likely than during the time that they are sick. The fact that they can detect the virus in the nose by a test, that test doesn't tell us how much the virus is in the nose. Obviously, by time, the amount decreases. And as the time passes and the amount decreases, then that risk of transmitting infection to someone else decreases. So at least one study that I looked at, the median time was about 31 days for the test to be still positive in the nose, ranging from 18 to 48 days. Now, does that mean that a person will be contagious, will be able to transmit the infection to someone else for 48 days? Very, very unlikely. بالعربي أيوة ممكن إن المرض يتنقل بعد ما الواحد يبتدي يتحسن، إنما كل ما يتحسن أكتر كل ما هيبقى عرضة أقل إنه ينقل المرض لشخص آخر ممكن يتعرض له. حوالي شهر 31 يوم ممكن يكون التحليل اللي في الأنف إيجابي، بس ده مش معناه انه علشان التحليل ايجابي انه العدوى قابله. احنا بنعمل التحليل عشان نقدر لو حد محتاج يرجع شغله او حاجه زي كده يقدر يطلع في شغله او في امور حتت اخرى فيها ناس بسلام ولا لا.
Thank you. The next question is for Dr. Farag. Can the virus that cause COVID-19 be spread through food, including restaurant takeouts, refrigerated or frozen packaged food? And also, can I get sick with COVID-19 if it's on food?
هو الفود has many parts. الفود when it's cooked hot, inside the cooking pot is no virus. لكن المشكلة لما يجي يتحط في plastic container and the guy is handling the plastic container to you and he's infected, the chance the virus will be in the plastic cover still exists. And when you do pay by money exchange between you and the guy is the money is infected, you still can get the infection. We had too many cases in one of the coffee chains. Too many cases they have infected people and they shut down the coffee stores because it's not the problem in the coffee beans. It's just a problem that that the people working dealing with the money, dealing with the plastic, and dealing with the container transmit the infection. الأكل by itself لما هو بيتسخن وبيكوكد جواه لو ما فيش هيبقى فيه فيروس كوكينج. لكن لو الأكل اتحط في بلاستيك كونتينر أو اتعاملت مع فلوس اختلطت بينك وبين الراجل اللي بيبيع، there a chance إنك أنت الفلوس بتبقى طبعا infected. وزي ما قال الدكتور شريف ان الجيرم بيقعد على البيبر 2 days. فلو الفلوس دي كانت هو حتى الراجل اللي هو بيبيع هو is not infected and the guy he gave it to him is infected, the chance ان الفلوس دي تبقى فيها infection. ففكره ان حد يبقى بيشتري حاجات من الماركت هات وكان يعني يفيل سيف 100%، لا هي مش سيف 100%. طبعا اكتر حاجه سيف 100% اللي انت ممكن انت تجهزها في البيت وتكوكت. لكن طبعا كل الهوستلز in نيويورك area and New Jersey they're getting every day some kind of delivery food and they try to use it as less as they can, food out of the box without touching the box.
Thank you so much. اهلا دكتور سلامه، نرحب بحضرتك. دكتور سلامه يعني كان بيعمل الراوند وانا عارفين ان انت تعبان وفي نيويورك نفسها، لكن ربنا عوضك جدا.
العفو يتصور.
Thank you so much.
بركة
We appreciate your work in the front line.
شكرا.
So I have a question for you. يعني نخش سخنين على طول. دكتور سلامة, can I get infected by going for shopping wearing a mask؟ يعني ممكن واحد يجيله كده infection أنا طالع shopping أكل مثلا ومع إن أنا حاطط الماسك.
هو الماسك will give you other people protection more than us protected. Mainly the mask will help from the entrance of the virus through the respiratory system. But there is other ways for the virus to be carried on. The hands and the clothes and all these things. So if we have the mask, protection is good, but the hands get touched with the areas that's infected, and then the hands goes to the nose or the face. That also can cause transmission of the disease itself.
شكرا دكتور سلامة. دكتور سلامة بيقول إنه الماسكس بيخلي إنه الميكروب ما يخشش من القصبة الهوائية، لكن ممكن الميكروب يجي من العينين، يجي من النوز كده. شكرا دكتور سلام.
The next question is for Dr. Karas. Will warm weather stop the outbreak of COVID-19?
That's a great question, and that would be amazing if that is the case. We know that from seasonal influenza and other coronaviruses, that they have a seasonal effect, that they're more prominent in the winter times, and in the summer times they're much less prominent. And coronaviruses in general survive shorter in warm and humid weather. We unfortunately do not have data though for the novel coronavirus to affirmatively say that yes, in the summertime we will definitively have less cases. I think it's a little too early to make that determination. So again بالعربي الانفلونزا وانواع مختلفه من الكورونا فيروسز عامه ليها يعني بتبقى موجوده اكتر في الشتاء وفي الصيف بتقل ولما بيبقى الجو دافي ورطب بيقل الناس اللي بيبقوا انفكتد من الكورونا فيروسز عامه او من الانفلونزا. بس الكورونا فيروس المستجده اللي هي دلوقتي مشكله في العالم كله ما عندناش لسه، ما نعرفش، لان احنا ما حصلش قبل كده ان احنا شفناها في جو دافي في الصيف وقدرنا نقول ان هي فعلا هتقل. فاحنا لسه مستنيين نشوف هل ده هيحصل فعلا زي ما كان بيحصل مع كورونا فيروسز مختلفه قبل كده.
اوكي. سؤال للدكتور هاني عشام الله. ايه درجة الحرارة اللي ممكن تموت ميكروب كورونا؟ What's the temperature that may kill the virus of COVID-19?
وانا بصراحة ملياش في الحتة دي، فانا افضل ان الدكتور شريف يجاوب احسن مني فيها بدل ما اقول حاجة وبعدين اطلع شكلي وحش.
اوكي دكتور شريف اتفضل.
ما اعرفش.
طب خلاص كنت انا جاوب بقى.
شوف ما كنتش هتبان. هو السبب ان بنسأل فيه ليه؟ بعض الناس بيقولوا عارفين انتوا لما يبقى الماسكس تبقى مش كتيرة، ففي بعض الناس يقول لك ايه ممكن مثلا تحطها في الفرن على درجة 160 فهرنهايت لمدة 20 minutes يموت الميكروب كده.
طب
يعني
بعد اذن دكتور شريف انا هجاوب على الحتة دي، لان احنا المجموعة بتاعت الراديشن اونكولوجيست اللي هم اللي بيعالجوا بالاشعاع اتفقوا انه يشوفوا هل ممكن ناخد الجاونز والحاجات اللي بنلبسها في العمليات ونعرضها للراديشن. فلقينا عشان نعمل كده لازم تقريبا 4 أيام، ويعني مش هتنفع. بس بعد كده لقوا ان الالترا فايولت والدراي هيت لمدة 4 ساعات 75 درجة مئوية لقوا ان اي فيروس بيموت. فدلوقتي في ستانفورد وفي جونز هوبكنز ابتدوا فعلا يوز الجاونز and the masks by reheating them 75 degrees for 4 hours، يعني 75 درجة مئوية لمدة 4 ساعات يعني في فرن مش في مايكروويف. بليز دكتور شريف صلح لو في حاجة قلتها غلط.
Okay, I want to make sure, did you say 75 degrees Celsius or Fahrenheit?
No, I said Fahrenheit.
Oh, Fahrenheit. Okay. Because Celsius, we would all cook if we try to put ourselves in that temperature. For sure, the viruses will, would be less survival at a higher temperature. Exactly what temperature and the idea about putting like a hair dryer on your clothes or something, all these are things that are people thought of, but were never proven, and I don't do them myself. I just wash my hands when I enter home. بالعربي ما اعرفش في درجه محدده اذا كانت 75 فahrenheit ولا لا، يعني درجه حراره معينه، انما من المتوقع انه الفيروس يعيش اقل في درجه حراره اعلى.
Thank you.
The next question is for Dr. Mossad. Can mosquitoes or ticks spread the virus that causes COVID-19?
Thank you, Abuna. For an easy one, the answer is no. It's been definitively assessed, and they didn't, in fact, mosquitoes, but at least there has been no cases of mosquito-transmitted coronavirus that have been reported anywhere in the world. And there are mosquitoes in many, many countries that this virus is prevalent in.
Thank you.
بالعربي مفيش نقل بالبعوض من شخص إلى آخر.
شكرا. دكتور سلامة لو تسمح. What should I do if I have had close contact with someone who has COVID-19؟ أعمل إيه لو اكتشفت ان انا كنت قاعد مع واحد وراح مديني تليفون بالليل قال لي على فكرة انا طلعت positive COVID-19؟
Unmute yourself يا سلام. Unmute yourself please.
I'm sorry. هو طبعا ده بيسموه the first contact of the case, zero case, and then the first contact of the case. This patient, if he has symptoms of any presentation like any cough or any fever, any symptoms of the COVID virus, he has to go and be tested, and if he needs treatment, also they could be given some treatment. If he's this first contact tested and becomes positive, he needs treatment. This is one approach. If the first contact have been tested and is negative, he can get a prophylaxis for the COVID virus. Okay. قول بالعربي؟ Okay. الشخص اللي بيتعرض للحالة الأولانية يسموه first contact، يعني أول تعرض للحالة دي. لو عنده أي أعراض للكوفيد بس زي السخونية أو الكحة أو الديارية أو loss of taste or loss of smell، أو يعني عدم هو التذوق أو الشم، يعني يشوف الدكتور بتاعه. لو شاف الدكتور والاختبار بتاعه بوزيتيف لازم يتعالج. لو شاف الاختبار بتاعه طلع نيجاتيف ممكن ياخد prophylaxis لكوفيد which is available، يعني and acceptable treatment يعني.
شكرا. أشكرك.
The next question is again for Dr. Mossad. Am I at risk for COVID-19 from mail, packages, and so forth?
Thank you again for hopefully another easy question, because the answer is no. I looked up the United States Postal Service website yesterday, and they explicitly said, about the things that they're doing to try to have the workers clean up and things of that sort. And I guess if you think about it practically, by the time the mail is sent from one place to the other and then sorted and then in a car and then back to your mailbox, it is again, there have been no cases that have been reported for transmission of packages or by mail. بالعربي مفيش نقل خلال البوسطة.
شكرا. طيب دكتور فرج, should contact lens wearers take special precaution to prevent COVID-19؟ يعني ال contact lens disinfecting solution, is it effective؟ بالعربي لو حد بيحط ال contact lens هل ممكن الميكروب يجي؟ وهل السوليوشن بتاع المحلول بتاع الكونتاكت لينس ده يمنع او يموت الميكروب كوفيد-19؟
طب هو في بيبر published Friday دكتور ديفيد شاو from Rutgers University in New Jersey. هو اصلا ophthalmology, and he reported two things. If you using contact lenses and you are not in contact with any patient, you should use extra precaution to wash your hand longer and try not to touch your hand after you put the contact lens. But if you have somebody at home, it's COVID-19, or you work in a place has COVID-19, he recommended people not use a contact lens because they find there is two cases. The tear has COVID-19. So in these two cases, the door is a part of the secretion from entire body has a COVID-19. ففي بحث اتنشر موجود على الانترنت من دكتور ديفيد شاو من نيوجيرسي يوم الجمعة 23 البحث كان بيتكلم على الكونتاكت لينس، علاقتها بالكوفيد 19. ما عندوش عيان كوفيد ممكن يستخدم الكونتاكت لينس، بس يعمل اكسترا كير في غسيل، يغسل ايديه كويس، في نفس الوقت ما يقدرش يعني he don't touch his eyes after that. لكن لو العيان، لو في حد دكتور او حد شغال في مكان او حد من الاسره بتاعته كوفيد 19 he should not فيها كوفيد 19.
شكرا.
Thank you. Again, Dr. Mossad, next question. How can I protect my child from COVID-19 infection? Should children wear masks?
So basically, we teach our children the same things that we are telling ourselves and telling other people to do. They're hard things because they're habits. They're not a pill or surgery that we do. They are habits that we need to try to practice in terms of social distancing and hand washing and avoiding touching face and nose, all covering our coughs and sneezes, all these behavioral things that we are trying to do, we have to teach our children. Children 2 years and older should also be wearing masks if they go out in public, in a grocery store or something. Younger than 2 years, it's unlikely that they will be able to tolerate a mask. And some people actually, for whatever medical problems, they cannot tolerate a mask, and we have to understand that. بالعربي نقول للأولاد نفس الحاجات اللي بنقولها لنفسنا وللآخرين من ناحية الابتعاد 2 متر عن الآخرين، نغطي الكحة، نغسل إيدينا، كل الحاجات اللي احنا بنقولها لينا والآخرين الكبار نقولها لأطفالنا بحيث إن هم يحاولوا يفهموا ويتعلموا نفس اللي احنا بنعمله، ولازم نكون صادقين مع نفسنا ونعمله احنا علشان هم يشوفونا بنعمله فيعملوه هم. ومن ناحيه الماسك، الاطفال 2 فاكبر ممكن يلبسوا ماسك، اقل من 2 صعب يلبسوا ماسك لان الغالب مش هيقدروا يستحملوه.
شكرا. دكتور سلامة again. But unmute your microphone.
Yes, sir.
Thank you. Are the symptoms of COVID-19 different in children than in adults?
هو انا دكتور للادلتس يا تونا. I'm sorry يعني doctors. I don't think there is differences except if there's children have some immune problem or recurrence or a disease like diabetes when they are young. The symptoms, I don't think so. There is difference between the two presentation, but I'm not quite sure about this question.
بعد إذنك يا بونا I'll try to answer. يعني أنا دكتور أورام، بس بسبب إن الكنيسة عندنا الناس مش عارفة تروح لدكاترة، ف I have been taking care of 60 COVID patients during the last 2 months because families are not able to reach their doctors. There are very, very rare instances of children affected by the virus. Out of the 60 families that I know of, and 40 of them have children, I only have 1 child, 12 years old, who may have COVID symptoms, and is not even, I'm not sure, because he was never tested. اللي أنا بحاول أقوله إنه بالرغم من انتشار الفيروس جامد قوي وسط الكبار، والخطر أكثر على السن الأكبر زي ما زملائي قالوا اللي فوق 65 سنة والناس اللي عندهم قلب والناس اللي عندهم حاجات في الرئة وكده، إنما الأطفال نادر جدا لما بيصابوا، وغالبا بيكون عامل زي ما يكون إنفلونزا بسيطة قوي ما بتحتاجش أكتر من كده.
شكرا.
Can I report one case?
Yeah, تفضل.
There is an infectious disease doctor works with us here, and she got tested positive, and she went home and she gave her the disease to her husband and her son, who is 13 years old. And so she said the same presentation, and she took care of all of them in the same house, and they all recovered. أقول بالعربي؟
Yeah, that's okay. Thank you.
تفضل.
Dr. Karas, do you have any experience with the children too?
So I don't, but so I have to go and look at the CDC to see what other things have been reported. And as everyone has mentioned, it's typically same symptoms but milder. But the main issue is when little John and little Mary go and see Giddu and Teta and go and give them a big hug. They can be, even if they don't have severe symptoms, they could be vectors of transmission to disease. So I agree that they should have the same precautions that they should have in order to avoid transmitting the disease to others. But typically the symptoms are much milder.
Let me summarize what they said in Arabic. بيقولوا إنه في شافوا أطفال أقل وفي شافوا أطفال إنه يعني الأعراض كانت أقل وفي شافوا الأعراض almost زيها وفي فمن الواضح إنه more research is needed في الموضوع ده. شكرا. بنبشوي تفضل.
The next question kind of touches on the same thing with children, and that question is was originally also for Dr. Salema or Dr. Karas, or it's about children again. And the question is, while schools is out, can my child hang out with their friends? Dr. Karas.
Sure. So I think, again, it follows along with the same question and same answer as previously mentioned. It's the concern is mostly if they go and mix with other kids and other children, they may transmit that disease and become carriers, even if they're asymptomatic, and bring it back to their own family members. And in so doing, you defeat the purpose of social distancing. So it is advised against having a large group of children playing together in close proximity.
Thank you.
سؤال لدكتور مسعد. Is there any chance that the 18 months timeline for development of a vaccine can be shortened? السؤال كده بيقول إنه هل ممكن ال 18 شهر بتاع الفاكسين يطلع ويستخدم تتقلل شوية والفاكسين يعملوا حاجة كده يبقى متواجد للكل؟
هقول بالعربي الأول، إحنا كمسيحيين وكأقباط دايما عندنا رجاء. In English, yes, we always have hope. In terms of science, the standard way of manufacturing vaccines and testing them, make sure that they're safe, make sure that they can make people have some immunity, and then make people be protected from an actual disease. That takes that 18 months that they said. Obviously, if they work harder, it could be shorter than 18 months, but by how much, we don't know. There are other ways to discover vaccines, something called reverse vaccinology, and that really requires gene information and bioinformatics, and that could shorten the duration to just a few months, but by how much we really don't know. بالعربي 18 شهر المتوقع، ممكن يكون أقصر من كده حتى بالحاجات اللي ممكن نعملها نتأكد إن هي مش مضرة ومفيدة وتمنع المرض. ممكن يكون أقصر شوية، إنما بقد إيه ما نقدرش نعرف. وممكن لو استعملنا وسائل جديدة غير الوسائل المتعارف عليها في عمل الأمصال عن طريق الجينات، ممكن يكون أقصر بكتير، بس ده كلام يعني غير معروف إنه هيحصل، إنما ممكن يحصل.
شكرا. ننقل على مجموعة كبيرة من الأسئلة عن الكونفاليسنس بلازما. يعني موضوع مهم جدا وخطير وناس كتير بتسأل فيه. اتفضل يا ابونا بشوي.
Next question is for Dr. Ashamalla. Simply put, what is convalescent plasma?
Okay, so I'll answer through my discussions with other places who do convalescent plasma. Basically, people who are tested positive and now they have antibodies, now they draw the antibodies and they try to give it to certain people who have the virus. And it's not approved, it's still experimental. There is a trial going on in the States now in several hospitals, but it's only allowed for the respiratory rate over 30, oxygen saturation must be less than 93, and 50% of the lungs has to be infiltrated. And usually they give it only to people who have underlying diseases. And up till now, we cannot say this is proven, but we are looking forward to some results. And I go بالعربي بعد كده. I hope Dr. Salama, Dr. Shrifa, Dr. Karas can add. الكونفاليسنت بلازما معناه انه عيان جاله الاصابه وبعد كده جسمه المناعي ابتدى يكون اجسام مضاده ضد الفيروس، فبيروح يتطوع ويدي جزء من البلازما بتاعته، بياخدوها وبينظفوها وبياخدوا الاجسام المضاده دي وبعد كده بيحقنوها لعيان تاني عنده الاصابه. بس لازم يكون مش اي عيان عنده اصابه، ده لازم يكون عيان جدا، بمعنى انه غالبا عدد مرات التنفس في الدقيقة أكثر من 30 مرة، يعني بينهك خالص. تاني حاجة مستوى الأكسجين في الدم أقل من 93%. ثالثا إنه لما بيعملوا أشعة على الصدر بيلاقوا أكثر من 50% من الرئتين مصابين بالالتهابات الكورونية دي. إلى جانب غالبا أغلب الناس اللي بيحاولوا يعني يجربوا فيهم، لأن لغاية دلوقتي ده تجارب لم يثبت مفعولها حتى الآن، وإن كان في بعض الناس بتقول بتجيب نتيجة جامد قوي، بعض الناس بتقول لأ، لكن كل اللي أقدر أقوله إنه التجربة متاحة للناس في أمريكا يدخلوا فيها، بس مش أي حد بيدخل فيها. Please زملائي if you feel you want to add, Dr. Sharif, Dr. Karas, Dr. Salama, Dr. Farag.
And we have more questions. It may open like يعني big discussion actually. Like if somebody is going to his primary care doctor and asking him for help, can a physician obtain access to that plasma to treat that specific patient? يعني لو واحد دكتور وواحد راح له قال له الحقني أنا عايز البلازما دي علشان أخف، هل ممكن الدكتور ده يجيب البلازما دي وازاي يجيبها والموضوع يبتدي منين يعني؟
So I think for that there's three main ways to obtain convalescent plasma to treat COVID-19.
Okay.
And it's typically, as Dr. Hani Ashamallah mentioned, it's someone who's very sick, so they're typically in a hospital setting. In order to be A, they're sick enough to be in a hospital, and B, to be monitored when they receive the plasma. But the three main ways are either through a clinical trial that the hospital is participating in. That's one way. The second way is through an expanded access through the Mayo Clinic IRB. And that could be, so if you're a local physician at a hospital that does not have access to plasma, you could go to uscovidplasma.org/physicians, and you could register your hospital. You could first identify and see if your hospital is on the list. If it's not, you could register your hospital and register yourself as a local physician and a PI. You could then register your patient, and then there's other steps that you have to complete, including completing a 4-hour post-transfusion form, reporting any side effects, and completing 7 days post-transfusion form.
Wow.
So this is the second way to do it. The third way to do it is for single patient emergency access. And these requests are typically, they go through the FDA. Depending on the time of day that you call or try to get that information, I could share the website, but it's through the FDA.gov/media/98616/download. And there's a form there that you could download and fill and email to the FDA. And the phone number to call is 1-866-300-4374. And that number could also be used overnight if there's an emergent case after 8 p.m. to 8 a.m. Eastern Standard Time. You would use that same phone number to call to get emergent authorization. And once you have that authorization from the FDA, you could then go to your local blood bank. So you could go, for example, through the Red Cross. They have an application that you could fill where you could inform them that you have the approval by the FDA to obtain the plasma. Or you could go to, let's say if you're in New York, you could go to the New York Blood Center. They have an application that you could fill, and you could obtain the plasma through those different methods.
Wow. So let me summarize this, okay? So وهقولها بالعربي while I'm summarizing. يعني في 3 طرق انه ممكن الواحد يحصل فيهم على البلازما دي اللي فيها الانتي بوديز لعلاج الحالات الخطيره. اول حاجه عن طريق لو في ترايل، الترايل تبع ميو كلينيك، لو المستشفى بتاعتي شغاله فيها مظبوط او داخله في الترايل دي. تاني حاجه لو تبع اخش دايركتلي على يو اس كوفيد 19 يعني ويب سايت معمول للدكاتره علشان خاطر يخشوا ويشوفوا اكسس الحاجات دي. وتالت حاجه عن طريق الاف دي اي، انه بعمل باي ريجستر الدكتور والعيان بتاعي مظبوط. طب في الحاله دي يعني في ال3 دول ممكن انه انا يعني اكسبدايت لواحد تعبان جدا، اقول لهم الحقوا ادي واحد تعبان قوي، واقول لهم على فكره انا عندي واحد عنده البلازما اهو، تعالوا نوفق الاثنين دول مع بعض. Is that possible?
So for the لو حالة مستعجلة, you'd go through the third method, which is through the FDA,
Okay.
Where you would either go through the website during the day or give them a phone call. Again, the phone number is 1-866-300-4374,
Okay.
and to get emergent verbal authorization. And after that, within a 2-week period, you should fill a specific form that is also available on the website. And once that is done, you could simply go to the Red Cross or to a blood center, and they all typically have an application that you could fill and tell them,
Okay.
I have this authorization from the FDA. Here is my patient. Here's their blood type. I would like to request emergent access for convalescent plasma.
I see. يعني ما فيش حاجة انه مش زي الكدني، يعني مش اخد واحد في ايديا واقول ده على فكرة معاه بلازما وانا عايز بلازما، تعالوا طلعوا منه البلازما والدهاني، مش كده.
يعني
السؤال ده very common.
Right.
يعني you don't know how many times you get on our phones, please يا ابونا بندور على واحد بلازما A positive كده، فعايزين
ممكن يا ابي. Yeah, that's a great question. لو واحد يعني لو عارفين مثلا ان في واحد كان عنده COVID-19 and fulfills specific criteria and he's 28 days out of his disease course or 14 days after the disease course and test negative, ممكن you go to a blood bank to donate that plasma, which can then be used للشخص المعين ده العيان ومحتاج البلازما. But it can be done through that way.
Done this way.
Yeah.
Wonderful.
Yeah.
Very good. Thank you so much. And this should be done through the FDA or now through the blood bank?
So again, so 3 different ways. So either المستشفى نفسها عندها clinical trial. A second way is for a doctor to apply through the Mayo Clinic website. It's uscovidplasma.org/physicians. And then you'd have that hospital have access to that plasma. So لو عندك عيان أو 2 أو 5 أو 10 أو 20, you could get that and it would be expedited. أو الطريقة الثالثة لو في عيان واحد and it's emergent, then you go through the FDA route, where you either call them or you fill an application and send it, and then go to a local blood bank and provide them with that information علشان to obtain that plasma for your patient.
Great. Can I ask extended another question please? يعني دلوقتي ممكن نقول انه لو عندنا داتابيز وسط الكوميونتي الأقباط بالعيانين اللي ريكفرد، ممكن الداتابيز دي استخدمها لحد يعني تعبان قوي لو العيانين دول وافقوا على، طبعا في confidentiality والكلام ده كله، لو العيانين دول وافقوا ان هم اللي هم ريكفرد يوافقوا ان هم ينقذوا ناس تانية، ده احنا we can do a lot with this، مش كده؟ يعني احنا كلنا مجتمعين مع بعض، احنا الناس الكابتك كوميونتي wonderful كابتك كوميونتي، Egyptian community in general يعني. When I say Coptic I mean Egyptian. اي جنس، اي لون، اي دين كمان. يعني لو انا اقدر انه عندي الداتابيز دي موجوده تحت ايديا وابقى عارف يعني I can use it، مش كده بالمنظر اللي انت قلته لي ده؟ Yes.
ممكن ابونا، بس يعني I would just qualify that by saying لازم يبقى confirmed disease. So if they were يعني لو هم عايزين يدونيتوا I would make sure that they have tested positive, have done a nasopharyngeal swab أو عملوا serological testing, and then they're 14 days out of their disease course.
Correct.
So after you have these qualifications, absolutely, it would be great to have a specific database, and then if someone needs it, they could be then directed to a local blood bank, يعملوا donation, and then that could be
to be
linked
used
that way.
specifically. يعني يبقى ده موجود under the name of somebody else.
I just wanna warn about something. This is not yet
it's experimental, absolutely
proven.
Correct.
I think, Abuna, the way you are put it, you may be giving hope more than we doctors or scientists are 100% proven yet.
Correct.
Experimental study. دي حركة تجريبية. للأسف في واحد مات من بلازما. أنا أعرفه، يعني أعرف واحد في مستشفى في نيويورك مات من البلازما بسبب ألرجي. فما نقدرش نعرضها بطريقة إنه خلاص يا جماعة إحنا لقينا الحل، كل واحد لقى واحد ياخده في إيده ويروح يعمل ترانسفيوجن. يعني خلينا برضو واقعين شوية. الموضوع لسه تجريبي. زي ما قال الدكتور كراس، ده لازم يتعمل جوه مستشفى، ما ينفعش واحد يعمله في عيادة بتاعته. الانجيو اديما اللي ممكن تحصل is very high risk for dying from the plasma. فالموضوع لازم يتعمل under a lot of restrictions. We should not just in a phone call like this we say we are making it available, let's make a list of our Egyptian patients. لأن يا ابونا على قد ما قدسك عندك حق فعلا، شعبنا حلو وعايز يقدم الأحسن، إن كل الآباط اللي كانوا بوزيتيف ودلوقتي عندهم بروفن في البلازما عندهم انتي بوديز، بليز روحوا نيويورك بلاد سنتر، روحوا الريد كروس وتبرعوا بالبلازما بتاعتكم. انتوا كده بتخدموا المجتمع كله. احنا دلوقتي مش عايزين ندور على عايز اخدم مجموعه معينه. اللي عنده انتي بوديز it's 20% of New York City عندهم 4% عندهم بس antibodies. The very rare number. My own son happened to have antibodies and he went and gave transfusion today. لكن كم واحد عندهم الانتيبوديز وكم واحد ما يعرف او ما يعرفش؟ نخلي الناس اللي جات انفكتد اللي اصابوا عايزين نعمل لهم تيست، ولو طلعوا عندهم انتيبوديز ارجوكم روحوا تبرعوا. اكتر من كده يا ابونا كون ان احنا نماتش ourselves personally as a physician, I would be very worried about that.
Okay, thank you. Just in case, because many people they say it is very terminal, he's dying or she's dying, please we need help. Just in case. Okay, thank you so much. We understand. Thank you.
أبونا ممكن أتكلم؟
تفضل.
صراحة I agree with Dr. Ashamalla. Number one, this is experimental investigative trials, and there is a lot of things with the investigation that goes with it, and the patient safety is very, very, very important. That's number one. Number two, there is no يعني الناس كلها, all the people that you want something from my mom, something from my father, something from my sister. There is no doctor who write a prescription for a convalescent plasma and they go get it and give it to the patient. Number three, the convalescent plasma process is different from the bone marrow donation process. And I agree with Dr. Ashamala. This is a very, very big thing. It has to go through the channels that has more control and more form of more form of arrangement with the government and with the statutes. So it's a good way of treatment, but it's not proven yet. So this is my point there.
So should we prepare ourselves with a database of patients who were COVID positive and recovered completely, or no?
We should, but it has to be with organizations.
Correct. But at least I mean for our community, should we prepare something like this?
أبونا هو once الحد أي واحد in your community اتصاب وخف زي ما قال مايكل المفروض يعمل تيست ويشوف عنده الأجسام المضادة ولا لا. لو طلع بوزيتيف أنا رأيي الكنيسة توجهه للريد كروس إذا كان في different state أو نيويورك بلاد سنتر لو إحنا في نيويورك أو نيوجيرسي. بعد كده هم بيقوموا بالعمل اللي بيقول عليه مايكل في الثلاث حاجات دول. وهو ده اللي احنا عايزين نعرف الكوميونتي بتاعتنا بيه. لو حضرتك if you were infected and now you are tested positive for antibodies, kindly go and give. It will not affect you, it will not make you dizzy, you will not lose blood. It's few cc's of plasma, you will feel good and you have given to the community.
Thank you. أبونا بشوي تفضل.
Next question is for Dr. Karas. What is serology testing, and can I be tested using this method?
So serology testing is typically, it's a part of this conversation. It's to look for antibodies for someone who had COVID and has had an immune response to it. And it is part of the testing to look to see if someone can be a potential donor for convalescent plasma.
Okay. Thank you. If I have recovered from COVID-19, am I immune to it? Or there is a kind of mutation may happen?
Immunity has two kinds. في solid immunity. Solid, it's like measles. Measles, you get it one time in your life, and then it's good for life. Like in COVID-19, is no data say it has a long-term immunity, and the immunity we have it right now, which most of the physicians believe in, is that if you get next infection, will be much less symptoms. But is not immune as a measles or immune as others. Solid immunity so far. That's what we understand it so far. فعندنا الاميونيتي في نوعين. في نوع immunity يقعد مدى الحياة زي الحقة، وفي immunity بتديك حاجة seasonal. يعني once ان خلص السيزون الاميونيتي بتضيع والجسم بعد كده بيرياكت عادي. اللي احنا فاهمين من كوفيد ممكن يكون عندك immunity الانتي بوديز في الجسم بتاعك، بس ممكن مش هتحميك 100%، لكن ممكن تجيت reinfected and less symptoms.
Thank you. شكرا.
Next question is also for Dr. Farag. Am I at risk if I go to a funeral or visitation service for someone who died of COVID-19? Also, am I at risk if I touch someone who died of COVID-19 after they passed away?
البوينت كان في واحدة امبارح intern Coptics lady. She was expressing herself that she took one of the daughter family to her father and he already passed away. The way she described it, that the daughter looked to her father's body through a glass window. Because as far as we understand it, if anybody died in a hospital bed, the entire room is already contaminated. So if you go inside emotionally, you have to touch him, you have to have a gloves and mask. But if you are in funeral home and the body just came to awake, or you went to the back of the front yard of the church for prayer, the chance to get infected is not really exact in this point. Like in to go to touch the bed, the wall, his phone, his iPad, which is recently died in hours, this stuff will still have the COVID. But everything have to be clean. His clothes have to be clean. His personal stuff have to be clean if he decided to keep it for memory.
Thank you so much. Thank you. سؤال دكتور سلامة. Are there any medications I should avoid if I am COVID-19 positive لو أنا عيان يعني؟
I don't think there is medication contraindicated for patients who have COVID-19. But if we start treating COVID-19 patients with some of the medication that has some side effects, like hydroxychloroquine has effects on the heart and the conduction system, we have to be very careful. ما اعتقدش ان في ميديكيشن كونترا مش مسموح ليهم للعيانين اللي عندهم كوفيد او كورونا، لكن العيانين بتوع كورونا خدوا بعض الادويه المتاحه للعلاج دلوقتي، ولازم يخلي بالهم من السايد افكتس دي ما ممكن تتضارب مع الحاله بتاعتهم او مع الادويه اللي هم بياخدوها للامراض المزمنه الموجوده عندهم.
شكرا اشكرك. بونا بشوي اتفضل.
For Dr. Mossad, are empiric antibiotics recommended for patients suspected of having COVID-19, and also are angio-converting enzyme inhibitors or ACE inhibitors or ARBs should be stopped in COVID-19 patients?
So the first question, so antibiotics, so specifically speaking about antibacterials like amoxicillin, let's say, they're not recommended to be empirically given to everyone with a COVID-19 infection. Obviously, if they develop a secondary bacterial infection, meaning that they have the virus and then they have another pneumonia on top of it from a bacteria, then this should be treated with antibacterials. And with regards to the specific medications for blood pressure or for the heart, ACE inhibitors or angiotensin receptor blockers, because the virus attaches in the respiratory epithelium to the ACE2 receptor, it was thought that some people said we should stop, some people said we should start. Bottom line is, if someone is already on an ACE inhibitor long term, at least there are no data to say that it should be stopped. If you want to start someone on something for blood pressure in the process of taking care of a patient with COVID-19, then you should probably use something else, just because we don't know. بالعربي مضادات حيوية زي الأموكسيسيلين مش ما تعطاش لحد عنده كوفيد 19، انما ممكن تعطى لحد عنده كوفيد 19 وعليها بكتيريا تاني غير الفيروس بتاع كوفيد 19 لعلاج التهاب رئوي بسبب البكتيريا، انما المضاد الحيوي مش هينفع الفيروس نفسه. وبالنسبه للادويه بتاعه الضغط او القلب اللي هي ACE inhibitors او ARBs، هل نوقفها؟ لأن في كلام انه هل نوقفها او نبتديها او لا، لانه الفيروس بيدخل الجسم عن طريق جزء في الانف او في الرئه، عن طريق جزء شبيه بالدواء اللي بيوقفه ده. الخلاصه انه لو واحد على الدواء مش لازم نوقفه، انما لو محتاجين نبتدي دواء لواحد مش لازم نختار الدواء ده بالذات علشان نبتدي.
شكرا. عندي كم سؤال كده في بعض، like combine the questions to a chest doctor or pulmonary physician. عندنا احنا دكتور سلامة ودكتور كراس. So I'll tell you the questions together, then شوفوا اسموهم ازاي كده. Are any changes recommended this from a physician? Are any changes recommended to the asthma treatment plan if my patient with asthma has COVID-19? وتاني بقى برضو if a patient tests positive for another respiratory virus, should that exclude COVID-19 as a cause of illness? And what's the role of the chest X-ray in such diagnosis? نقولهم بالعربي عشان الناس تتابع معانا. لو من دكتور بيسأل لو واحد عنده أزمة، وهل في تغيير في علاج الأزمة لو الشخص ده طلع أو جاله كورونا، ولو هو يعني طلع له التست بوزيتيف لحاجة تانية غير الكوفيد، هل ده معناه انه ما جالوش كوفيد خالص؟ والحاجة الثالثة ايه يعني التشست اكس راي، هل ليها يعني رول في الدياجنوزس في التشخيص ولا لا؟
Sure. So regarding asthma, currently there's no changes recommended. I think the specific question is related to using steroids in patients with asthma because of a concern of viral shedding, which was seen in the past with SARS. But currently, if you look at guidelines by the CDC or by the American Allergy Association, there's no changes recommended. So if someone is supposed to be on inhaled steroids, they should continue it. If they need a course of steroids for their asthma exacerbation, they should receive it. In fact, even in some centers, in later stages of the disease, steroids can be an adjunctive agent that is experimentally used to try to curb the hyperinflammatory states seen in some patients with COVID. So that is the first question. And sorry, Buna, the second question was related to
if a patient tests positive for another respiratory virus.
Yes, so typically in the hospital, our protocol was to do a nasal PCR to capture different viruses to see if another virus is positive. And if that is not the case, to then proceed with COVID testing. I haven't seen many co-infections between two viruses at the same time, but it is a possibility. And regarding your third question regarding imaging, so on chest X-rays and CAT scans, you typically see a peripheral infiltrate seen as a sign of a COVID-19 infection. It's pretty sensitive, as in it picks up a lot of patients that have an pneumonia or an inflammation in the lungs from COVID, but it's not very specific, as in you could have other causes that could have a similar presentation on imaging.
Maybe Dr. Salama can answer in Arabic.
Yeah, please.
Sure. هو بالنسبة للسؤال الأولاني، الناس اللي عندهم أزمة وجالهم الكوفيد، طبعا ده بيخلي البيكتشر، بيخلي الصورة أصعب شوية، ويخلي الأزمة بتاعتهم أصعب شوية في العلاج. فمحتاجين الناس اللي هم عندهم أزمة دول يبقوا very careful to avoid to have ان هم يكون عندهم المرض ده، ومحتاجين عنايه اكتر من الناس اللي هم عندهم كوفيد without ازمه. العيانين عندهم ازمه بيبقوا مور سيكر، بيبقوا عيانين اكتر من العيانين اللي عندهم كوفيد without ازمه. بس ده ما بيغيرش في العلاج زي ما الدكتور كراس قال. الحاجه الثانيه بالنسبه في فيروسز ثانيين موجودين، طبعا ممكن يكون احتمال انفلونزا A ولا انفلونزا B ممكن تحصل مع الكوفيد، بس مش is not common زي ما الدكتور كراس قال. بالنسبه للاكس راي، انا I agree انه we need to have a chest X-ray within في خلال يومين ثلاثه من اعراض الكوفيد اللي هي مش ما خفتش يعني وما راحتش. you need to have X-ray. الاكس راي بتبين حاجات كتيره قوي، وممكن تكون يعني احتمال قليل قوي ان ما تبينش حاجه. فعشان كده بعد 3 ايام لو اعراض ما خفتش محتاج تجد، يعني لازم نحاول نجد chest X-ray.
شكرا ابونا بشوي تفضل.
This next question is for Dr. Farag. How to wash fruits and vegetables? Unmute you, Doctor.
دكتور يا أيمن unmute.
موضوع الفروت والفيجيتابلز as hot food before. الفروت والفيجيتابل فيها 2 parts. الفروت والفيجيتابل by itself, the plastic bag you carry it on, and you dealing with the people sell it with the money. طبعا الفيرست two parts, الماني والبلاستيك bag, assume it's infected, so you have to deal with it with gloves. Like vegetable, yeah, according to a recommendation from the CDC, don't use bleach. Bleach is not healthy. Bleach is not healthy for a human being. Bleach can use for clothes, can to the floor, can use to clean bed in the hospital, but not fruit and vegetable. I'm repeating it because it is misunderstanding. The 3 steps from the CDC to clean fruit and vegetable. First one, you're running the water in the fruit and vegetable for 15 minutes, and then you soak the fruit and vegetable in under the water with lemonade, and then you really run it again with water. After 3 wash of this, the chance to get infected, even if it was the fruits in the service has some kind of infection, it's going to be washed. طبعا ارجع اتكلم بالكلام بسرعه بالعربي. المشكله مش في انك تروح تشتري يعني مش في الفروت باي اتسلف خلاص، لا، المشكله البلاستيك باج اللي انت هتحط فيها الفروتس، وانك انت بتتعامل بالفلوس مع البياع. طبعا الحاجتين دول طبعا هم دول هيجوا لك انفكشن لو البياع انفكتد او يعني في انفكشن في بتوين انت جبت. لكن لو الفروتس او الفيجيتابل عليها كورونا، انت هتاخدها وهتحط ران ووتر لمده 15 minutes. warm water, you don't have to be hot, you don't have to be cold. Don't use any kind of bleach، لان البليتش ده هيأثر على صحه الانسان، وده ممكن يتريجر ازمه للناس اللي هي سنسيتيف للبليتش. الحاجه الثانيه بتسكر الفروت والفيجيتابل في acidic atmosphere which eliminate is more than enough for another 15 minutes, and then you wash it again for another 15 minutes. This is how to clean it up.
Thank you so much. Dr. Andrew Mikhail, I have a question for you. But it's a very hard one. سؤال صعب. بعته حد بيقول ايه؟ اقوله بالعربي الاول بعد كده اقوله بالانجليزي. يقول انا مكتئب جدا وخايف جدا. هيقعد قد ايه اللي احنا فيه ده كله؟ امتى نرجع للحياة الطبيعية؟ I'm very depressed and scared. How long this may take to go back to normal life?
Yeah, I mean, it's a hard question. And I think the most important thing is, how do we find a new normal life? And I think the biggest struggle is that people are scared because they're out of their routine. So the biggest thing, I think, is to kind of get in a normal routine again. I mean, there's a lot of services that are having church on Sundays and have services throughout the week. I think the things that we have to try to control are the things that are in our hands. I mean, we don't know what's going to happen in the future, but we know what we can control. What are the things that we can control? Yani what we were talking about before, exercising. So go for a walk every day. Yani taban, using the guidelines that we have, the recommendations and those things. This exercise is very important. It's very good for your mental health. It's very good as a stress reliever. And so always kind of trying to be in control of the things you can control. Something else you can control is the way that you, yani, I think the biggest thing that's empowering is knowing that if I keep with the recommendations, washing my hands, not touching my face, keeping my social distancing, I'm in control of that. And I can control whether I get the disease or whether I spread it. But it's also about empowering yourself and understanding that you're in control of that. Trying to find other routines. Yani, people are coming up with new hobbies that they do at home. I know family friends that are finding new things to do with their family, such as sewing things or making quilts or getting into cooking or getting into other things to kind of create some kind of normal life for you and trying to adapt what life that we have now. I know a lot of people are doing things online with Zoom, through the church, through Bible studies. So again, I think it's more about not worrying when this is going to go back to normal, but adapting to this new normal life and how can I keep in a regular routine to keep this to keep myself mentally healthy. Biggest thing also, the media. Please do not sit in front of the TV and watch the media all day. And if you want to go to sources of information, have a consistent source that you're going to, the CDC or the World Health Organization. These are the 2 main sources of where all of your information comes. Because if you're sitting at home, you're watching the media, you're watching TV all day, taban, you're gonna feel anxious. You're gonna feel like, you're hearing all this information. You have to change all these different things, and it's gonna make you worry because you're not keeping your mind occupied. So the most important thing, limit your media time, exercise, stay in a daily routine, and educate yourself. educate yourself on what's going on and stay informed, but to use, limited resources so that you're not, driving yourself to be, depressed or anxious.
Thank you so much.
One thing, so sorry, 100% to everything Dr. Mikhail said. The one other thing I would just say, because the question just said in the beginning, أنا مكتئب جدا, or if I'm very depressed, I would just caution you, if you feel this way, it's also important to get help. If you're doing all these things that Dr. Mikhail is recommending and you still feel incredibly depressed, depression can also be life-threatening. And دي حاجة مهمة لازم نفتكرها, and this can be the #1 cause disability worldwide. If you find yourself in this position, when life is amazing and we're going outside and going to Disneyland, people can still get depressed. So if life is incredibly difficult, it's even more of a stress and even more of a reason that we can find ourselves in a tough position. So I would just suggest, لو شايف انك انت حاسس انك مكتئب جدا, ما تخافش انك انت تكلم دكتور او تكلم therapist. This is okay. The church blesses it. It's not something that's a weakness or a sin. وبالذات في الوقت ده, دي حاجة مهمة جدا.
شكرا. أنا خليني ألخص دول بسرعة. دكتور أندرو مخيل بيقول أحسن حاجة إنك تطلع من اللي أنت فيه ده, إنك أنت تحاول إنك أنت تتفهم الوضع الجديد, امشي عشان المشي هيساعدك تطلع من المود ده. خليك أنت in control, يعني خد بالك من كل المفروض يتعمل انك تحمي نفسك ازاي, وده يبقى كروتين, واتعلم حاجات جديدة انك انت تحب تمارسها زي خياطة, كوكينج, طبيخ, الزوم في الكنايس. وخد بالك من الميديا, التلفزيون وكده مشكلة كبيرة جدا, انك انت لو استسلمت لكل اللي بيقولوه هتلاقي نفسك كده الدنيا سودة قوي. عايز تعرف اخبار المرض ايه, روح على CDC واعرف, ده احسن سورس تسمع منه. بعد كده دكتور ميرهم قال انه لو انت حاسس فعلا انك انت مكتئب قوي, احتمال انت لازم تروح تشوف, مش احتمال, ده انت لازم تروح تشوف دكتور علشان خاطر العلاج, لانه ممكن الاكتئاب ده في حد ذاته يبقى مشكلة صعبة جدا, خطيرة اكتر من مرض كمان. شكرا. دكتور بشوي اتفضل. ابونا دكتور بشوي اتفضل.
So the next question was for Dr. Karas. What is a cytokine storm, and how may the virus cause death by blood clots in the lungs?
So this is a very elaborate question, and it's definitely a question that is still under research. Cytokine release syndrome is basically when it's an acute systemic inflammatory syndrome where your immune system, in trying to protect you, can actually harm you by attacking your organs. That's typically characterized by fever and multiple organ dysfunction. And you would have high inflammatory markers in your blood, like high ESR, high CRP, unremitting fevers, cytopenia, hyperferritinemia, and you have elevated cytokines. And that is why some of the experimental drugs that are used target specific interleukins, like anakinra targets IL-1, tocilizumab targets IL-6, steroids are more inclusive or more global. So there's different agents that are looked at experimentally at the moment, and it's something that is still very investigational. And regarding your question about clotting, so there's a concern that COVID produces a form of DIC, or disseminated intravascular coagulation, where you have microclots, small clots forming in different organ systems, causing as a cause of respiratory failure and different organ failure. The exact pathogenesis of how this happens is not very clear yet. Some of the proposed theories include inflammation, stimulating an upregulation of something called fibrinogen, which increases your clotting, or binding to things called endothelial cells, or the inside part of the vessels, causing like an attack of these vessels from the inside, which makes your body form clots. Like when I get a cut on my skin and my body heals and forms a clot there, it's a similar process, but inside of the vessels. that causes a sort of a clotting in those vessels.
Can you summarize this in Arabic, or Dr. Hana Ashamallah, can you summarize this in Arabic?
I can try. يعني هو بصراحة قال كلام كبير قوي، بس يعني كل يعني تقريبا يعني بيقولوا ان السيتوكاين سيندروم ده بيخلي أجهزة كتيرة جدا في الجسم تتفاعل ضد بعض، وبتؤدي في الآخر انه بيحصل التهابات، وممكن يحصل انه كذا عضو في الجسم يصاب، كأنه حصل اللي هو بيسميه مالتي اورجان فيلير، انه ان الكلى والكبد والقلب كل ده كأنه حصل نوع من الالتهاب لكل حاجة. طبعا احنا مش فاهمين قوي ليه بيحصل الموضوع ده، ليه بيحصل ان الجسم بيحارب نفسه، لكن هم بيلاقوها دكاترة الصدر، وطبعا دكتور سلامة بليز كوركت مي، بيلاقوا انه في حاجات عالية كتيرة في تحاليل الدم اللي بيعملوها، زي السي رياكتيف بروتين وحاجات زي كده. انا مش عايز اتكلم كلام علمي قوي عشان الناس اللي مش دكاترة في الكول، لكن بيلاقوا الدكاترة بتقدر تحدد ان في التهابات قوية قوي حاصلة، وبيضطروا يتعاملوا معاها كأنه الجسم بيحارب نفسه، زي بالظبط الأمراض اللي بتصاب زي الروماتيزم أو الثعلبة أو الحاجات دي.
شكرا. طيب I have a case, and very interesting case. I'm gonna make it like open for all of you who may contribute any answer. في حالة كده أنا هعرضها، أقولها الأول بالعربي بسرعة وبعد كده أقولها بالإنجليزي. شخص 34 سنة جاله، كان شغال في مستشفى، جاله كوفيد 19، تعب جدا، وصل المرض ده كمان لمراته، تعبه، بعد كده خف وهو في البيت. بعد ما خف وراق بعدها بأسبوع أو 2 خرج شوية، عمل شوبينج وكده، بعد كده إنه رجع البيت في يومين بقى سخونية جامدة جدا، مش عارف إيه السبب بتاعها ده. راح المستشفى، هو في المستشفى يحاولوا ينزلوا درجة حرارة، خدت وقت طويل ما نزلتش، all of sudden بقى تعبان جدا، مش قادر يتنفس، دخلوه العناية المركزة، لقوا القلب بتاعه is failing، يعني مش قادر ينبض كويس، حطوا له aortic بامب، يعني قالوا له دي 10 أيام بس الاورتيك بامب دي موجودة. يعني كان لسه متجوز وعنده بيبي 9 شهور، حاجة عجيبة جدا، وكان ما عندوش ولا مرض قبل كده. فأنا يعني so this 34 years old person who got infected, was working in a hospital, got infected, he infected his wife, then he was recovered completely within about a few weeks without any symptoms. He went out for shopping, came back with the severe fever, high fever, went to the hospital, could not lower the fever. All of a sudden he got into the ICU, couldn't breathe. He required aortic bump. They took biopsy of his heart, and they said that he has all his glands inflamed, especially thyroid. Then they say that prognosis is not good. So we need explanation. We need to know the prognosis. We need to know if we can help him with anything, please. And I'm gonna leave it this way. تفضلوا يعني.
Let me start it before Dr. Salama and Dr. Kalas. It's most probably the first time he don't fully recovered. And right now, we don't really, we cannot, there is certain stuff we cannot explain it after, but let's face what we have now. What we have now, he has multiple organ failure. He has lungs failed, his heart is failed, and he has multiple organ failure. He's an aortic bump, mean the heart is not enough blood, So the aortic pump is helping the heart to keep running. Right now, the only thing I believe he can get really benefit to get him out of this is plasma treatment. This is my vision. I saw many cases like this, and they get some benefit out of the plasma, but he is not in good shape. And when you reach this multiple organ failure, that's what we go back to the first cytokinase storm. It is cyto means cells, kinase means rapid. He has a gush of cytokinase rushing to all the organ. They took a biopsy from the heart because most probably the heart has myocarditis, and they want to see if this only myocarditis or has more than the viral infection in the heart. Maybe they thought he has maybe bacteria on top of this. But I believe, let's face it now, I'm sure he's in kind of preserves in ICU, and he needs the plasma. And I'm sure the team treating him is thinking 100 times to give him plasma, because right now this is the only safe gate for his life. This is my opinion on this, and Dr. Salam, Dr. Ras can add.
تفضل دكتور. whoever would like to add تفضل.
اوكي اتكلم بالعربي ولا بالانجليزي؟ It's okay.
اللي حضرتك
لا يعني I agree 100%. This patient he's been now in multi-organ failure syndrome. الفيروس ده بيأتاك الهارت in different ways. It could be direct invasion of the cardiac muscle by the virus itself. That's one mechanism. It could be also another way عن طريق cytokines زي ما الدكتور قال ان الcytokines دي it goes into the cardiac muscles and affect it in different ways. It can affect the conduction mechanism, it can affect the contractility mechanism, it can affect and cause acute MI. For a patient to reach the situation where he needs intra-aortic balloon pump, it means there is a big damage happened to the heart. It can happen acutely, meaning within 3 days, 4 days, or it can happen subacutely within a week or two. The treatment for this is to support the heart right now. It could be the antibodies could be also helping, but the main treatment line of treatment now is to support the heart and get him out of this situation into a more stable situation.
Thank you so much. Dr. Karas would like to add something.
I just agree with everything that was said. It's tough to evaluate a specific case without all the details, but from what was presented so far, it seems like the patient is severely ill, has likely myocarditis with acute heart failure, and that's why they're on an intra-aortic balloon pump. And I agree. I think at this point, it's just providing excellent ICU level of care, where you're supporting the different organ systems while allowing the body to recover. I don't know if there's a specific magic bullet per se. I think we'd have to review the case in a bit more detail to see if there's something specifically that would help in this case.
أبونا بعد إذنك
تفضل يا حبيبي تفضل.
أنا ما عنديش medical advice، بس أنا هطلب من كل الناس اللي سامعة إنها تصلي للأخ دون، لأنه بصراحة ده الماجيك بوليت بقى اللي عندنا لما بيخجل الأطباء ومش بيعرفين يتعلموا يعملوا إيه. وكلنا المجموعة الموجودة أنا عارف قد إيه إيمانهم، فلو كان الأطباء والغير أطباء يصلوا للأخ دون. I think if we all gather in prayer with Sayyidina at the end of this nice forum, I think that's the best we can offer him, plus all the great advices that were offered.
Thank you so much. Actually احنا فعلا في الكنيسة he's not in our church, but when we heard about it, every gathering on Zoom, we pray for him. That's correct. And we have faith in this. Thank you so much. أشكركم جدا. أبونا بشوي تفضل. Let me summarize the answer quickly. يعني هم بيقولوا الإخوة الأطباء بيقولوا إنه في الغالب إنه ما كانش خف 100%، فدخل المستشفى تاني لما الميكروب كان لسه ما مشيش. حصل له سايتوكاين ستورم اللي هي تفاعل الجسم على بعضه أثر في كل أعضائه. حصل أعضاء كتيرة في جسمه حصل لها يعني بقت معلولة. اللي حصل إن القلب كمان اتضر، فعشان كده خدوا منه العينة. ودلوقتي لأنه القلب يعني تعبان، فحطوا له البامب دي علشان خاطر يقدر يعني يشد حيله القلب. وهم العلاج الطبي يعني بيقولوا انه يعني فعلا لازم القلب ده يتظبط خالص، بعد كده ممكن يستفيد من البلازما. بعد كده طبعا دكتور هاني في الاخر بيفكرنا انه اهم حاجه الصلاه، فاحنا قلنا ان احنا فعلا كلنا بنصلي من اجله، وهنصلي بعد ما نخلص من اجل هذا الانسان. اشكركم جدا. ابونا بشوي اتفضل.
The next question is for Dr. Salema and Karas. One is, what causes a COVID-19 patient to have difficulty breathing, and how do ventilators help in the ICU?
So if I may answer, so difficulty breathing from COVID can be through different methods or different ways. One way is by reducing something called surfactant, or things that line the inside of the lungs, without which the lung would collapse on itself. Another way is through direct viral attack of the lungs, whether through an inflammatory process or through direct viral attack to the lungs. Also having the microthrombi that we spoke about before, where you have clotting inside the vessels that supply the lungs, causing difficulty breathing. That could happen in different phases of the disease process. Ventilators typically allow you to for the lungs to rest in a way, and depending on how you manage the ventilator, you could relieve when your lungs you're unable to oxygenate or ventilate by yourself. It gives the body a break and it takes over that process. Dr. Salema may add some more.
Okay, Dr.
I think Dr. Salema has to go back to grounding.
طب دكتور هاني تحب تترجم
يعني هو دكتور مايكل كراس بيقول ان اللي بيخلي الكوفيد يأثر على الرئتين وبيخلوهم يحتاجوا ان يتحط على جهاز التنفس الصناعي، ان اوقات عن طريقتين: يا اما الفيروس نفسه بيصيب الرئة وبيخلي يحصل زي الشعيبات الهوائية بتحصل انها بتدخن، فما بيحصلش تفاعل بين الاكسجين واللي موجود في الرئه وبين الدم اللي واصل للرئه، وبالتالي الدم بيبقى اقل في كميه الاكسجين اللي فيه. الحاجه الثانيه انه بيحصل زي افراز لمواد كتيره اسمها السيرفاكتنت، والسيرفاكتنت دي بتعمل زي ما تقولوا التهاب جامد في الرئه، فبتخلي برضو نفس التفاعل بين الاكسجين وبين الدم بيوطى قوي. جهاز التنفس الصناعي بيتغلب على الموضوع ده، انه بيضخ كميه اكسجين جامده جدا، فبيزود وصول الدم والاكسجين لبعض.
شكرا. سؤال برضو كده على بعضه for the chest doctors, pulmonary and infectious disease. What criteria do you use to put someone on a ventilator? And also, what is the criteria to withdraw a ventilator from someone to let him die peacefully? And do you select certain critically ill patients to be on a ventilator versus just comforting measurements? And how long usually the patient would be on a ventilator for COVID-19? أقولها بالعربي بسرعة. إيه اللي يخليك تحط واحد على جهاز تنفس صناعي؟ وهل ممكن واحد تختار له جهاز تنفس صناعي واحد تاني تقول لا مش هقدر اديله جهاز تنفس صناعي، ده هو مش هيعيش عن كده؟ وهل انك انت ممكن توصل انك انت تشيل عيان من على جهاز التنفس علشان هو مش هيعيش؟ وايه هي غالبية يعني المدة اللي ممكن الانسان يبقى على جهاز التنفس؟ شكرا.
So some of the main reasons to place someone on a ventilator is basically they have an acute respiratory failure where their body, they're not receiving enough oxygen to supply their organs, or they have a buildup of carbon dioxide and they're unable to exhale it because of the damage to the lungs or to the vessels supplying the lungs. And that's a very individual, depending on how each patient is tolerating it, or also if they're very tachypnic, where they're breathing very fast and we're worried that they might get tired and they're unable to support their breathing. Some other reasons include if they have an altered mental status where they are confused, we're worried that they may aspirate or have the saliva go into their lungs or food that they intake go into their lungs, which is a risk factor. So these are some of the main reasons why someone is placed on a ventilator. Typically, when making that decision, part of that is assessing whether the ventilator would help that patient long term, and in that case, it's multifactorial. So one part is the patient, their age, their medical conditions, and how reversible we think their disease process is. So whether we think that this is something that is acute, that we could help them through with a ventilator and they could recover, or we think that this is something that is chronic and it is unlikely that they would come off of a ventilator. And this is a discussion that you would have with the family and with the patient on an individual basis to make that determination. They're typically offered to patients, but depending also on their goals of care and on how they want to live their lives, whether they're, for example, some patients might say, I would like to live the longest, regardless of how my recovery process is like. Others might say, I've had a healthy life. If I get sick enough, I don't want to be placed on a ventilator and have a prolonged recovery period. Or I don't want to have a tracheostomy where I'm tied up to a ventilator long term, or I don't want to end up in a nursing home. So these are all different considerations and decisions that are made with the patient and with the family member. So one way to help make those decisions early on is to have the patient have a discussion with the healthcare providers and with their family about how they want to live their lives in case they get to a point where they need to be intubated and placed on a ventilator, and also appointing a healthcare proxy or someone to make decisions on their behalf when they're unable to make that decision. If they don't have a healthcare proxy, they typically can have a surrogate appointed to them by the medical professional, depending on who is their next of kin or closest to them in their family lineage, whether it is their spouse, it's their parents, their children, and there is a certain order that you follow, depending on how close that person is to the patient.
Maybe دكتور أيمن فرج لو عنده أي إضافات للفكر ده، لأن هو برضو ماسك وحدة كاملة للميكانيكال فنتيليشن.
أو يعني أحاول تقطع بالعربي عشان الناس تقدر تفهمني برضو.
لو تسمح.
هو الفنت دي ليه شوية كرايتيريا. العيان بيتحط على الفنت لما يبقى عدد النفس بتاعه أكتر من النورمال، والنورمال من 12 ل 18. لما بيوصل 30 بنحط العيان، أو العيان زي ما قال دكتور كراس مش قادر يحمي الأبر الواي، يعني مثلا لو خد أكلة خد مية وشرب والمية دي بدل ما تنزل على المعدة تروح على اللنج، فإحنا ساعتها بننتيوبيتهم. الحاجة الثالثة إن الأكسجين اللي في الجو 21%، فالعيان بنديله نزل كانيولا فالأكسجين بيوصل 40%. بنحطه على ماسك فيس ماسك بنقدر نوصل الأكسجين كونسنتريشن 60%، لكن ساعات ستيل العيان مش قادر يكسجينيت هيمسيلف، فاحنا بنحط البريزنج تيوب عشان نوصل 100% oxygenation ونقدر نكنترول الفنتيليشن بتاعته. فطبعا احنا في اول بدايه الكوفيد 19 كنا فاكرين ان كل هتجيت ماتش بنفيت من الفنت، لكن مع الوقت اكتشفنا ان الفنت sometimes is not helping as much as we thought. فحاليا احنا we going back to the اللي هو الفيس ماسك والحاجه دي. فوانس العيان ميت ذا كرايتيريا فور انتوبيشن بينتوبيت. بالنسبه للعيان اللي هو comfortable measurement دي حاجه بتكون ديسايدد بين الدكتور ما بين العيله بتاعته. ويا ريت احنا من دلوقتي فورورد از كوميونتي نبتدي نخلي الممبر يديسايد هم فولي اويك هم عايزين ايه تعمل لهم لما بيخشوا المستشفى. هل محتاجين يبقى انتوبيتد، هل عايزين ريسبيتد لو القلب توقف. الديسيجن ده لو انسان عمل هو وفولي اويك تو هيم سيلف هتبقى ماتش ايه هو وماتش ايزي للفاميلي ممبر وماتش ايزي للميديكال تيم تو هيلب. طبعا العيان اللي هو كوفيد 19 وعلى الفنت امتى يقدر يخرج ويطلع الفلور؟ في شفنا ناس بعد 3 ايام بتطلع الفلور، وفي ناس بتقعد ب6 اسابيع بتطلع الفلور to improve. لكن most of the patient in the first week بيحصل markedly improve مع الفنت وبنقبل نكستبيت him ونطلعه على الفلور.
جميل. Thank you so much. Thank you. أبونا بشوي.
Next question for Dr. Mossad. Someone's uncle's been in the hospital for about 4 weeks. He's improved clinically, but he continues to test positive. And the questions is, what should they do now? Is he contagious, even though he recovered clinically completely? And also, what is the average length of a very sick patient for his hospital stay? What is the average hospital stay?
Thank you, Abuna. So address the first question first. So your uncle is less contagious, for sure. If he's recovered and is at home and doesn't have any symptoms, trouble breathing or fever, he's less contagious. Now, taking people out of isolation, the recommendations have changed over time in the last, let's say, month to 2 months from the Centers for Disease Control and Prevention, moving from a test-based recommendation to a symptom-based recommendation.
Oh,
so
nice.
A test-based means that you should have no fever without taking any Tylenol or anything else to reduce the fever. You should be feeling better, and you should have 2 tests that are at least a day apart, 24 hours apart, showing a nose test showing no evidence of virus in the nose. Now, it specifically says that the resolution of fever and the improvement in the symptoms of other symptoms, the trouble breathing, they didn't put a specific number of days on it. But when they decided they're going to, because they can't test everyone, or they would be testing this particular scenario and it's still positive. So they added another level of recommendation for taking people out of isolation. So 3 or more days without a fever, again, without any Tylenol, no trouble breathing for more than 7 days since you started to have a trouble breathing, and you don't have to have a test if you satisfy these particular criteria. So 3 or more days without a fever, improvement in the cough and trouble breathing, and 7 days or more have passed since you started to have any symptoms suggestive of the infection. So if you satisfy these, you really don't have to keep testing to get out of isolation.
Very good. Very nice.
أترجم ولا؟
يا لو تسمح، مهم أوي السؤال.
بالتأكيد إنه عمك أقل أو عمك أقل إنه يقدر يعدي حد تاني، مش بس بسبب إن التحليل إيجابي، إنه ده معناه إنه ممكن يعدي. حاليا الCDC قالت إنه ممكن الواحد يتشال من العزل بطريقة أو من طريقتين، يا إما عن طريق تحليل أو من غير تحليل. اللي بالتحليل إنه يكون ما عندوش حرارة ما عندوش تعب في النفس من غير عدد ايام محدد، ويتعمل له تحليلين على الاقل 24 ساعه بعاد عن بعض، والتحليلين يكونوا سلبي. الطريقه الثانيه انه يتشال من العزل، انه يكون عنده على الاقل 3 ايام من غير حراره، وانه اعراض التنفس تكون اتحسنت، وان يكون على الاقل 7 ايام عدوا من بدايه الاعراض. ممكن لو وفى ال3 شروط دي انه مش لازم يتعمل له تحليل علشان يتشال من العزل.
رائع. ثانك يو سو ماتش. احنا فاضل لنا سؤالين وكده كملنا ساعتين وشويه. نشكركم جدا. اخر سؤالين هيبقوا طبعا للفريق السايكاتري علشان يدونا حاجه كده يعني تنعنش شويه. I can't translate دي كلمه تنعنش. اوكي
ابونا انا رايي تخلي اندرو يتكلم عربي، هتلاقي مفيش ديبرشن في عند اي حد.
ده حلو قوي. فيري جود. احنا يعني طيب يبقى نخلي اندرو السؤال الثاني اخر واحد،
بس لازم بالعربي.
وبالعربي اندرو. اوكي دكتور ميرهم. How should the churches help to relieve stress, isolation, fear of not being able to talk fairly openly about our needs and concerns? والكهنة والشعب والسيرفنتس كل overwhelmed. ايه اللي كده يتعمل كده؟ يعني نجيب نكت مصر كتير مثلا يعني ايه اللي يعني what should be done okay actively just to get over this?
Well, it's a great question. نكت مصر تكون أحلى حاجة. This is the best, especially being it, Dr. Andrew. So I thought about maybe a little acronym that we can think of PPE. So PPE. The first P being presence. There's a beautiful book. Now, if anybody's has some time in quarantine and wants to read on how we can be helpful, it's called Becoming a Healing Presence by Dr. Albert Rossi from St. Vladimir's. He's an Orthodox psychologist.
Coming of what?
Becoming a healing presence.
Okay.
Yeah, and we actually, Dr. Haney, we had him invited as a guest speaker in another forum, which was beautiful. So why presence is the first thing? Because becoming a healing presence is not always about being physically present. Right now, the big first task of the church in the lives of the congregation and lives of the people is saying that we are present. We are with you in this. We are feeling this way. And if you feel overwhelmed and angry and scared and all these range of emotions, that's perfectly okay. It's perfectly normal. And we are present in it. And we can also connect it that we have this radical teaching in our faith is that our God was present in suffering. But this is our opportunity to link our theology to our practice, right? Our praxis of what we believe. And that's why you have something like Holy Sophia that can show you that link between theology and life. So that's the first P of presence, of how can we find ways to really be present with the people that we're in. The second P is prayer. So we talked a little bit about prayer, but if we remember the words of the Lord that were asked of him by the disciples, they said, Lord, teach us to pray, right? How do we pray? In this situation, how we're going to learn to pray is maybe different from how we learned to pray a month ago. For the task of the church is to say, the congregation is coming to us and saying, Abuna, please teach me to pray in quarantine, because this is new for me. Teach me to build a home altar. Teach me to have a prayer life where I didn't have it before. What does it mean to be still, to be present with God? So in this prayer, it's not just a usual throw around word of everybody pray and everything will be fine, but no, how do we teach really to pray? And at the second, in the same breath, reinforcing with the people is that, like Otzek said, and like Dr. Haney said, is that we are actually raising you up in prayer, that you are being prayed for. And there were great studies, of course, throughout the years that showed that when you have the experience of being prayed for, that you are being lifted up in prayer, this has physical and psychological advantages to you. And the last E in the PPE is expand. Expand our understanding. One thing that was said in a briefing this morning, instead of just thinking about when are we going to reopen the church, maybe we can think about how we will reimagine the church, right? We believe that the Spirit of God, the Holy Spirit, is alive and powerful, and he's working with us to do something different here. So how can we expand and reimagine what it means to be in the lives of the people? So that's the PPE that maybe can help us get through this time.
Thank you so much.
Add something too, Bruno. I'm sorry. I think something very important also is having, hearing from the priests, the congregation hearing from the priest is very, very important. I found that a lot of people get comfort in their father. They get comfort in their father asking about them on a regular basis. They get comfort in their father, hearing their voice. A lot of people miss the church, they miss the priests. So hearing from them on a regular basis, I think, is very helpful, because a lot of people, they've never had this happen in their lives. And what do you do when you go scared? You go to your father, your mother, and I think that mother, the church, and the father, the priest, are helpful in kind of easing some of that fear. Sorry on that.
Thank you so much. So let me translate this. Then we have a question for you, Dr. Mikhail, by Abuna بشوي. دكتور مرهم، أمينة مرهم بيقول بيدينا حاجة لطيفة جدا، بيدينا 3 حروف نفتكرهم. PPE. أول حاجة presence. يعني إيه presence؟ يعني يبقى فيه وجود في وجود becoming، إنه يعني أنا موجود، يعني أنا موجود وسط العيلة، موجود وسط الكنيسة، موجودين مع بعض. تاني P prayers. الصلاة يعني مش مجرد الصلاة اللي هو إيه، هو بيقول زي ما سألوا المسيح علمنا رب أن نصلي، فبيقول لا دلوقتي علمني أن أنا أصلي وأنا في العزلة، علمنا أصلي وأنا مريض، علمنا نصلي في المسبح العائلي. ثالث حاجة expanding، يعني إزاي أن أنا أوسع الأفق بتاعي، أوسع الأندرستاندينج بتاعي. reimagine التشيرش، يعني إزاي أتخيل الكنيسة بمفهوم أوسع وأكبر، مش مجرد المكان اللي أنا بروحه. بعد كده دكتور أندرو أضاف إنه الناس نفسها تسمع من الكهنة صوت الكاهن واتصال من الكاهن، والكاهن حاسس بيهم. أشكركم جدا على الكلمتين دول جمال، دول ليا أنا شخصيا قبل أي واحد تاني، وحاجة حلوة قوي. أتمنى أن أنا أكون وصلت المشاعر بتاعتكم. انتوا بتقولوا ان قلتوها حلوه قوي، انا جيت اترجم بوظتها بس حاولت يعني.
انا لو منك يا ابونا تخلي اندرو يقولها بالعربي.
لا ما دلوقتي السؤال ابونا بشوي،
مش هتلاقي ديبريشن في البلد كلها.
ما ابونا بشوي سؤاله بقى لاندرو بالعربي يا اندرو. اوكي لا هقول لك حاجه لطيفه كمان، خلي ابونا بشوي يسال السؤال بالعربي واندرو يجاوب بالعربي.
كده ما فيش ديبريشن ولا في الكليرجي ولا في الشعب.
لا ابونا بشوي.
السؤال يا اندرو
بالعربي يا ابونا.
حاضر. لما يكون في خوف او اكتئاب في وسط العيلة يعملوا ايه؟
طب اقول بالعربي بس حد يترجم لي بالانجليزي. اول حاجة تعملها يعني تشوف ده الحياة الجديد، يعني ده الحياة الجديد ان نتصرف فيه ازاي؟ يعني هنقعد مع بعض، هنصلي مع بعض، هنعمل ايه مع بعض؟ يعني هنعمل ايه في الروتين بتاعنا يعني كل يوم؟ يعني مثلا في ناس بيروحوا الشغل، وفي ناس بيروحوا الكنيسة، وفي ناس قاعدين في البيت. المفروض اول حاجة تشوف ايه اللي انت عامله في العيش الجديد بتاعتك. العيش الجديد صح. العيش الجديد بتاعتك، عشان ما نعرفش المرض ده هيمشي امتى، ما اعرفش هيمشي امتى. بس اهم حاجه انت هتعيش حياتك ازاي، انت هتعيش الحياه الجديد ده ازاي. يعني انت مثلا يعني انا بسمع من ناس كتير بيصلوا مع بعض كتير في البيت، وعاملين كنيسه في البيت عندهم، وعاملين يعني الاجتماع في الزوم يعني بالليل، وعاملين حاجات كتير قوي ما يكونش بيعملوا قبل كده. So I think مش عايزين وبرضه الخاف برضه بيجي من الحاجات اللي مش هنعرفها، يعني الحاجات اللي احنا مش عارفين اللي يحصل، ده اللي بيجيب الخوف. يعني احنا الحاجات uncertain بتجيب الخوف. بس الحاجات احنا certain of الحاجات اللي قدامنا، يعني الحاجات اللي قدامنا ممكن نتصرف فيه. يعني انا عارف انا هروح يعني اغسل ايدي هغسل ايدي وهبعد من بعض. ده الحاجات اللي في وشي. بس الحاجات اللي يعني اللي قدامي ده من يعني ربنا هيتصرف. هو ربنا جه ويعني جه عشاننا وجه يعني احنا لسه احتفلنا الريزركشن. يعني هو جه عشاننا، هو جه عشاننا. الخوف اللي بيجي من انا ما اعرفش I can't do this anymore.
بس نشكرك
But
جدا، احنا
I'll
فهمناك.
try to translate. I'll try to translate in English for those who couldn't understand.
Yeah.
That's the main idea is that the fear comes from uncertainty. People are scared because they don't know what's going to happen in the future. People are scared because they don't know how to respond to this kind of thing. But I tell people all the time, it's about adapting to this new life of, okay, I'm going to have a normal routine, and I'm going to let tomorrow worry about for tomorrow, but I'm going to stay with today. I'm going to stick with today. I'm going to come up with new things that I can do on a daily basis. I'm going to pray with my family more. I'm going to read the Bible more with my family. I'm going to focus on the things that I was not able to focus on before when I didn't have the time to focus on it, such as my physical health, my spiritual health, my exercise, all the eating healthy, figuring out all these new different hobbies that I can do so that I keep my mind occupied with things that I can control. The things that I can't control are in God's hands, and you have to have, this is where your faith becomes important and crucial, because if you have faith that God is going to do what is best for us, then there's nothing to fear, because in the end God is doing what is best for our salvation. And maybe this was a chance for us to take a time out of our busy lives and to refocus our lives on what is important, and that is through Christ himself. And glory be to God.
Thank you so much. This was wonderful. We have 3 questions from Amba David, His Grace Bishop David, and this is I'm gonna mention them, 3 of them, and we love to hear from you. The first question is, what are the doctor's recommendations when it comes to giving communion, provided that we do not change our traditional way of giving the holy mystery, the body and the blood separately? This is the first question. Second question, when is it expected to be safe for normal life to resume and people can return back safely to church? Number 3, is there another wave of COVID-19 expected this winter? We'll go. Start with number 3 first. Is there another wave of COVID-19 expected this winter?
So, Una, I will try to answer. At least the people who do epidemiologic studies tell us that even if the acute wave, it looks like the acute wave is decreasing in many parts of the country. Obviously, different parts are different. We're a big country. So even after that this virus is likely going to be with us for the rest of our lives. Now, having another acute wave, like an acute surge in cases next winter, I don't think we can say that there will be. So I guess at this point we will just say, hopefully not.
Okay.
Other 2 questions are so hard, so I'm not going to even go.
So السؤال الأخير اللي سألناه، هل هتيجي الميكروب ده تاني في الشتاء اللي جاي؟ فالإجابة بيقول إيه؟ نصلي ما يجيش، معناها إنه احتمال يجي يعني. السؤال التاني اللي هي when is it expected to be safe for normal life to resume and people can return back safely to church؟ تاخد قد ايه لغايه ما الكنائس تفتح بمعنى صح والناس تبقى في سلام؟
أنا هحاول أجاوب يا إبونا، بس يعني برضو يعني أكيد كل حاجة بنقولها ما عندناش بصراحة rules. للأسف البوليتكس is playing a dirty role in medicine. So the politicians want economy, so they are opening the country, at least from the way I am hearing scientists and doctors are concerned about, too early. يعني واضح ان السياسة بتلعب لعبة انه عايزين يفتحوا البلد بسرعة. احنا فعلا نزلنا كويس قوي بس بسبب ان في عزل. اغلب الاساتذه والدكاتره في كل الجامعات لما بنعمل فورم ديسكشن كلهم خايفين من another wave زي ما سيدنا بيسأل. ف we are all concerned about another wave. Whether this wave will happen sooner than the winter, we are very worried about more the summer when people go to parks and beaches. الحاجة اللي سيدنا بيسأل عليها ودي بقى في رأيي أهم، أنا أعتقد إن الكنائس هتفتح في خلال من أسبوعين ل4 أسابيع في رأيي، يعني كواحد observer يعني. لكن في رأيي إنه we have to have recommendations once we open our churches, how many, what to do when they enter, and where do they stay. In my opinion, and please, this is just an ignorant person speaking. Number one, there should be no meetings, no Sunday schools, no eating in the church. Only we open and we divide the people over their last name into 2 groups. No one can have communion twice per week. So for example, we open the church and we say from A to N, they have communion on Saturday, and from after N till Z on Sunday. تاني حاجة برضو كواحد جاهل بيتكلم، كل عيلة تقعد مع بعض، مش رجالة وستات، أنا ومراتي وولادي هنقعد في صف واحد، لأن إحنا عايشين مع بعض. We are not going to infect each other, so each family together we leave a pew open and then another مثلا أبونا أبراهام and his family are sitting. ثالث حاجة again واحد جاهل بيتكلم، أفضل إن الكهنة الكبار over 65 they do not give communion. again أنا بتكلم كطبيب، بس طبعا أنا بحب كنيستي قوي وبخاف قوي على، إحنا بنخاف جدا، وطبعا زمايلي يفهموا أكتر مني. over 65 unfortunately once they get infected their survival is a lot lower than the younger people. ثالث حاجة أو رابع حاجة، أفضل أي واحد داخل وهو داخل الكنيسة بتديله بيوريل في إيده، ومفيش واحد يدخل غير بيتقاس له temperature. كل واحد داخل الكنيسة إن شاء الله يكون بريست أو شماس غلبان زي، بيتحط له التمبشر، لو التمبشر بتاعته عالية يتقال له sorry you are not allowed to enter. وأنا شايف إن الدكاترة ممكن تساعد سيدنا عشان ما يبقاش سيدنا هو اللي يقول إن الدكاترة قالوا لي إن لو التمبشر over 99 you are not allowed to enter. ممكن يكون الحرارة عالية بسبب حاجة تافهة، لكن I believe at this level we cannot allow anyone to enter upon entrance, and I think this will happen in airports once airports will open. فاحنا هناخد التمبشر لأي واحد داخل وهنغسل ايدين كل واحد داخل. الأولوجية في رأيي لازم تتوزع عن طريق شماس هو قطعها ولابس الجلافز. ما ينفعش أبونا هو اللي يقطع دي، لأنه احنا عايزين خايفين على أبونا. فشماس بيقطع الأولوجية بجلافز، وبعد كده بيدي بالجلافز لكل واحد في إيده. ناحية التناول بقى دي الحاجة اللي سيدنا طبعا أنا مين أنا عشان أتكلم فيها، لكن بصراحة أنا يعني أتمنى إن احنا نعمل التناول اللي هو بيتعمل تحت emergency setting. يعني لو سيدنا رايح يناول حد في الاي سي يو بيديله الجسد متعاص في الدم. Because every time you go through water, blood and body, it's not the body and blood. We 100% believe that the sacrament itself has no type of infecting anyone. لكن الميثود بتاع الترانسميشن هي المستير نفسه أو الإيد الكان. فلو سيدنا يسمح إن ده يعتبر under emergency circumstances, as physicians we are recommending إنه الجسد يتحط في الدم والإنسان ياخده. I would allow no meetings after the church. I would ask people to leave immediately after they finish. In my opinion, they should take communion and go from communion out. لأنه المشكلة يا أبونا أو يا سيدنا إن إحنا لو اختلطنا ببعض بعد ما عملنا very good spacing و social distancing، لا سمح الله واحد فينا صحته كويسة وعنده 35 سنة لكن كارير، هينفكت واحد زي حالاتي مثلا رئته تعبانة أو كليته تعبانة وندخل في خوف تاني. سوري إن أنا خدت وقت طويل.
طب ممكن أد 2 بوينت بعد إذنك يا أبونا؟ بعد إذنك سيد. أول بوينت، موضوع تقبلوا بعضكم بعض. يا ريت موضوع يبقى يعني الناس تتعمل على الصدق بدل ما نتاتش ايتش اذر، لان ده ممكن لو كل واحد فينا هيقبل 3 4 حواليه الانفكشن ممكن تترافل. دي 1 بوينت. سكند بوينت، موضوع الاعتراف، يا ريت يبقى في بارير بين الكاهن والمعترف، حاجه ازاز، بحيث احنا عندنا في كل كنيسه 2 to 3 بريست وبيعدي عليهم حوالي مثلا في الشهر 150 واحد بيعترف. لو واحد او 2 فيهم انفكتد يبقى كل شهر احنا عندنا البريست ممكن يجيت انفكتد واحنا we cannot afford to lose a priest. فيعني خلينا براكتيكالي دلوقتي البنوك والكاشيرات بينهم وبين الكاونتر في سبيس وجلاس، اندر ذا جلاس في سبيس مفتوح قد 1 or 2 inch بس عشان اللي هو الكوميونيكيشن. دي بوينت. دي second point. third point, they run a test to run the IgM last week, 3,000 tests in New York State, 2,000 in New York City and 1,000 in upstate New York. The result in New York City was around 20% had the infection and they already either they don't feel symptoms or they had symptoms and they cured it. To reach the point you say we will not gonna have a big wave in the winter, we have to reach 80% immunity. احنا we just 20, by the end of the acute phase maybe we'll reach 30, 35. We still will need to reach 80% to reach points that we will not gonna have any more major attacks زي باقي الحاجات. When we will go back to the normal, this is our new normal and we have to adapt ourselves to the new normal. Thank you.
Thank you so much for everything, and let us get Sayyidna. Sayyidna.
Thank you. أنا بس عندي لدكتور هاني سؤال follow up question يعني my point is هي نفس المستير اللي ممكن زي ما حضرتك قلت ينقل، ولو ان يعني انا برضو I disagree، بس يعني هنعتبر كده، ما هو برضو ايد الكاهن اللي بتناول ما هي دي تنقل برضو، يعني ايد الكاهن بتخش برضو جوه بق كل متناول وكده. فانا مش عايز الناس نشكك الناس في التناول من اصله، لان دي هتبقى خساره كبيره جدا ان نشكك الناس. انا عندي ثقه 100% ان مستحيل ان المسيح اللي هو ادى للابائنا قال لهم خذوا كل هذا هو جسدي، وبعدين ادالهم الكاس كلهم مع بعض من كاس واحد، اشربوا هذا هو دمي، ومن كاس واحد. ده مش مستير يعني واحد بيشفط، يعني كل واحد بيشرب شرب. فانا عندي ثقه 100% ان مستحيل المسيح يؤمر بشيء ممكن ان هو طبعا ينقل اي مرض. فهل ايد الكاهن اللي هي هتناول الناس دي كلها، وطبعا لما ابونا هيناول مفيش بقى 6 فيت ولا اي حاجه، يعني اي واحد هيجي يتناول هيبقى قدام ابونا مباشره. انتوا رايكم ايه؟
يعني انا هرد يا سيدنا مجرد كبرضو زي ما بولس الرسول قال بغباوه اتكلم. يعني you are doubling the percentage by using hand one time and mystere another time. The body and blood, I'm 200% sure they are actually a treatment for any physical, psychological, or spiritual illness. 100% I believe. I don't want 2 priests to be subjected, and I don't want the same priest to قصدي مش عايز نفس الشخص يتعرض مرتين لإيد الكاهن. انا شفت يا سيدنا لو under emergency circumstances، لان احنا we may continue this for 1 year يا سيدنا. It's not just going to be some month. But if this is going to be the new norm for 1 year، انا شايف ان لو الكاهن بياخد وبيحطها ببقه من غير ما يلمس شفايف الانسان، ودي طبعا عايزه تدريب للشعب نفسه وتدريب للكاهن نفسه، يبقى احنا بنخلي الكاهن نفسه ايديه ما ولو الكاهن حس ان هو ايديه لمست شفايف، جايز يحتاج ينظف ايده في ساعتها. انا عارف يا سيدنا الكل بقوله ده غريب جدا عليا انا نفسي وانا بقوله، بس احنا بنتكلم على emergency situation، لانه unless كمان نطمن شعبنا ان احنا واخدين precautions، هم نفسهم مش عايزينهم يتشككوا. ايمان نيافتك، وطبعا انا بقول يعني كاني بحط نفسي تحت رجلين نيافتك ان انا كمان عندي 100% نفس الايمان، ان انا ما عنديش اي شك تماما في جسد ربنا ودمه ده. انا مستني اليوم ان يتفتح الباب، لكن مش عايز واحد ايمانه يكون متشكك شويه يقول طب انا ايش عرفني ابونا، طب انا ايش عرفني المستير، طب اللي قبلي كان بينف، طب اللي قبلي كان. فهي دي بس الحاجه يا سيدنا. انا برضو احب اسمع راي الدكتور شريف او حد من infectious disease specialist what he thinks.
من ناحيه المسافه او الديستنس ملهاش حل. اكيد الكاهن هيكون على بعد يعني اقل من متر، اقل من يمكن 2 فيت من الشخص اللي هيناوله. سو من ناحيه المسافه ما نقدرش نتحكم فيها. من ناحيه هل ممكن لو اخذنا نقل العدوى خارج البروسيس بتاعت المناوله خالص، هل ممكن العدوى تتنقل بمعلقه او بايد؟ الرد يس ان يس، ممكن تتنقل بمعلقه او ممكن تتنقل بايد. هل نقدر نغير في الطريقه بتاعه اخدال المناوله من غير ما نغير؟ احنا مش بنغير حاجه في المناوله. احنا المناوله هو انا اللي بعمل الجسد او الدم. الكاهن بيصلي الجسد والدم بيتحول، فاحنا مش بنغير في المناوله نفسها، احنا بنغير مجرد في الطريقه. لو فيه طريقه ممكن نقلل بيها العدوى اكتر للكاهن، لان الكاهن بيتعرض لكل شخص اكتر من مره، اقل بكتير من الشخص نفسه اللي بيتعرض للكاهن في المره دي. فلو في طريقه ان احنا ممكن نقلل بيها العدوى يبقى نحاول نعملها.
هو لاحظ يا سيدنا برضو احنا لو نيافتك وافقت ان الكنائس تاخد تمبتشر للناس وهي داخله، دي هترياج a lot of people who may have a low grade temperature and we are asking them medically speaking that they are not allowed in. تاني حاجة سيدنا، how about in the priest during communion you wear a mask during communion؟
ممكن طبعا ابونا during communion can wear a mask, this is not a problem. بس اللي انا فاهمه برضو ان هو حته ال6 feet دي عشان العطس او الكحه، يعني النورمال بريذنج ده ما بينقلش مرض، مش كده؟ يعني مش مجرد ان واحد قدامي بيتنفس عادي او انا ككاهن بتنفس ان ده ينقل المرض، يعني لازم في كحه، لازم يبقى في رذاذ طالع من الشخص المصاب، صح الكلام ده؟
لو تسمح يا سيدنا، كان في study recently بتقول انه ال6 feet دي للبريذنج نورمال. قالوا لو واحد بيكح يبقى 20 feet actually لو بيكح، والستادي دي I can send البيبرز ليها 24 feet actually. حتى قالوا انه اللي بيسنج اللي هيرتل وبيرتل بقوة بتوصل لغاية 20 feet. فهم الريكومنديشن الريسنتلي اللي انا قريتها كانت كده. واي ثينك كمان لما يفتحوا الكنايس هيبقى مانداتوري لازم 6 فيت ومانداتوري لازم ماسك الاثنين، مش يعني لازم الاثنين.
طب وهتناوله ازاي وهو لابس الماسك؟
ما هو عشان كده انا بقول كده يا سيدنا، انا مش عارف. احنا كلنا خاضعين للمجمع المقدس متمثل في قداسة بابا ونيافتكم كل الاباء الاساقفه، واللي هيقولوا المجمع احنا كلنا ولادكم بنطيعوا. في استراليا I heard just yesterday، ودي كانت في النيوز، انه احد الكنائس القبطيه كان البوليس راح لانه سمعوا ان احنا واحنا بنناول اقل من 6 فيت، وعملوا مشكله وقالوها على النيوز ميديا، قالوا دول في كونتاكت اقل من 6 فيت. فاحنا وجانا جيت اكسبوز لحاجات زي كده، و have to be ready. بس يعني لكن احنا ربنا يديكم الحكمه يا سيدنا، فعلا كلنا خاضعين لاي حاجه الكنيسه تقولها.
طب ربنا يدبر ويدي
فعلا
الحكمه.
ربنا يدي حكمه فعلا. شكرا نيافتك يا سيدنا، شكرا.
انا الحقيقه لما بدات كنت هبتدي بس كده في الانترودكشن واحضر كام دقيقه، بس الحديث الحقيقه كان ممتع جدا، very informative. انا ما قدرتش امشي خالص لغايه ما حضرت كل اللقاء. فانا عايز اشكر كل الاخوه الاطباء، دكتور هاني عشم الله ودكتور شريف مسعد ودكتور مايكل كراس ودكتور ايمن فرج ودكتور سلام، متهيألي هو مش معانا دلوقتي بس شارك برضه، دكتور مينا مرهم ودكتور اندرو ميخائيل. هل did I miss anyone ابونا؟
لا تمام كده يا سيدنا.
وعايز اشكر ابونا ابراهام وابونا بشويه اللي هم كانوا الاثنين اطباء سابقين ناجحين جدا على ترتيب اللقاء. وعايز اشكر دكتور ستيفن معوض اللي هو بيشتغل في ورا الكواليس يعني. I just want to add with a prayer. أنا بحبها قوي، هي مش my prayer. It's called the Serenity Prayer. It summarizes many things that has been said. بتقول إيه الصلاة دي؟ بتقول God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. يعني يا رب اديني السلام الداخلي ان انا اتقبل الامور اللي انا مش في استطاعتي ان انا اغيرها. في واقع دلوقتي، في نيو رياليتي زي ما الاخوه قالوا، في نيو رياليتي. we have to accept the new reality، وبعدين نبتدي نعيد ترتيب حياتنا على اساس الواقع الحالي. okay we have to change our life to adapt our life to this new reality. ما اقدرش اقول ان اعيش في دينايل واقول كل حاجه كويسه واروح احضن وابوس في الناس اما اقابلها مثلا. في نيو رياليتي وفي امانه ان كل واحد لازم يبقى امين على اخوه وعلى جاره، ان ما حدش يكون سبب في انفكشن لحد. فده حاجات ما نقدرش نغيرها. في new reality. We are living now in a new reality. Since COVID-19 began, it forced the whole world to be in a new reality. And we have to admit and we have to work together علشان ان احنا نحمي العالم اللي ربنا اتمنى عليه. لما ربنا خلق الكون ربنا قال اخضعوا الارض واخضعوها. يعني احنا المفروض ربنا مدينا الابيلتي ان احنا نخضع الكون حسب القوانين اللي ربنا اداها لنا، ان احنا نكتشفها ونخضع الكون. وفي كل شويه بتحصل مستجدات زي الكورونا المستجد، انتوا حتى بتسموه المستجد. ففي دايما مستجدات بتخلي الانسان لازم يتعامل مع الظروف الحاليه. فاحنا God give us the prayer that grant us the serenity، ان انا اعيش في سلام في طمأنينة، لان ربنا كبير، ربنا موجود، وربنا يدينا القدرة ان احنا نغلب اي شيء بنعمته. So God grant me the serenity to accept the things I cannot change. Number 2, to the courage شجاعة بقى، لازم الإنسان يبقى شجاع وعنده القوة. أستطيع كل شيء في المسيح الذي يقويني. the courage to change the things I can. في حاجات نقدر نغيرها. احنا ربنا مدينا نعمة كبيرة وعلم ومقدرة ان احنا نغير انفسنا والعالم اللي حوالينا. فالصلاة بتقول يا رب اديني الشجاعة ان انا اقدر اغير الحاجات اللي انا في استطاعتي ان انا اغيرها. ثالث طلبة the wisdom to know the difference. الحكمة ان انا افرق بقى بالحاجات اللي لازم اقبلها ما اقدرش اغيرها، والحاجات اللي اقدر بنعمة ربنا ان انا اغيرها. فانا حبيت اشارك معاكم الصلاة ديت عشان دي صلاة جميلة وأنا شخصيا بحبها جدا وبتكلم عليها كتير. I think it is very fitting during this time that we pray this prayer and ask God to give us number 1 serenity, number 2 the courage, and number 3 the wisdom. Thank you again for this beautiful symposium, very informative. I learned a lot. وربنا يعوض كل الإخوة اللي هم شاركوا في الإعداد أو شاركوا في رد على الأسئلة. ربنا يحميكم ويحفظكم ويكون معاكم ونسمع عنكم دايما كل الخير.
Thank you سيدنا. في محتاجين صلاة من أجل أخ 34 سنة في العناية المركزة وتعبان جدا جدا، ويعيني سايب مراته وبنته 9 شهور، وكان كويس قوي وقوله في صدن وخرج، لكن رجع تاني وقوله في صدن fighting for his life يا عيني في أي لحظة.
حاضر، نصلي له.
يا سيدنا.
ولو قدسك تعرف اسمه ابعت لي اسمه أذكره في الصلوات الخاصة وفي القداسات.
ممكن نذكر اسمه دلوقتي، الكل يذكر اسمه. ممكن يا سيدنا؟
انتوا معروف اسمه؟
just first name. اسمه الأخ جوزيف.
اوكي.
شكرا يا سيدنا، شكرا يا سيدنا. صلي لنا يا سيدنا واصرفنا.
اتفضل، انا بدأت بالصلاة، قدسك اختم. اتفضل.
لا يا سيدنا اتفضل نفتك.
اتفضلوا نشارك يا ابني. اتفضل.
حاضر.
بسم الآب والابن والروح القدس إله واحد آمين.
Thank you Lord for having us this time together while we're listening and learning a lot from your sons and your daughters that who asked for many questions, and we have our wonderful professionals and specialty from your kids, also from your children, answering these questions. Thank you Lord, because this is amazing to have everybody learning from everybody, to have that investment in your people, in your children, as one body, as one church. Thank you Lord for having our father and our shepherd Amba David, who is taking care of every one of us since the beginning, since he began with us, and especially during this rough time, during this time, organizing everything and giving us the courage and the wonderful spiritual care that all of us we need. Thank you Lord for arranging all this for us. Thank you Lord for everybody who labored hard to have this wonderful session together. Thank you Lord. Please our Lord, take care of every one of our frontline fighters and who are fighting on our behalf. أرجوك يا رب مع كل إنسان كده في الخط الأولاني بيعالجوا المرضى ويعالجوا هذا المرض. أرجوك يا إلهنا الصالح إنك أنت تقويهم وتديهم كده فرح، وتديهم عزاء للي بيعملوه، تديهم يا رب كده إكليل في السماء لا يعوض من أجل تعبهم اللي بيتعمل ده وما يتنساش أبدا يا رب. إلهنا الصالح طلبة خاصة من أجل أن يفتوا الأنبا ديفيد، قويه وخليه لنا واديله الصحة وطولة العمر وسطينا، أب حكيم وأب كل وداعة وسط كل ولاده، إن كانوا كهنة وإن كانوا شمامسة وإن كانوا دكاترة وإن كانوا من كل الشعب كله يا رب حواليه. طلبة خاصة يا رب من أجل إخوتي اللي تعبوا النهاردة في السيمبوزيوم ده، عوضهم يا رب على وقتهم، وعوضهم يا رب على تعبهم ومعلوماتهم، واديهم أكتر وأكتر. أجل صلوات العذراء مريم عننا والملك مخيل، وأجل صلوات قداسة البابا المعظم أنبا تودوس الثاني، وتديله حكمة يا رب من أجل الأيام اللي هو فيها حاليا، وأجل صلوات نيافة الأنبا ديفيد. يا إلهنا الصالح اسمع لينا صلواتنا، لك كل مجد وكرامة الآن والأبد آمين.
جعلنا يا رب مستحقين نهديك بالشكر ونقول أبانا الذي في السماوات يتقدس اسمك، ليأتي ملكوتك، لتكن مشيئتك كما في السماء كذلك. لا تدخلنا في تجربة مشي. محبة الله الآب ونعمة ابنه ربنا وإلهنا مخلصنا يسوع المسيح، شركة وعطية الروح القدس تكون معكم. امضوا بالسلام. سلام الرب
مع روحك أيضا. شكرا يا سيدنا، حللنا
شكرا.
سيدنا، حللنا سيدنا.
الله يحفظك. سلام.
Thank you so much everybody. ربنا يعوضكم كلكم.
Thank you, Mona.
سلام.
Thank you.